All right, we will resume. Next on our board agenda is our president's report. There are a couple of things that I want to share with the president's report. I do apologize, I don't have this in summary form, but I'm happy to send it. The first thing is we have finalized our dates for our professional development calendar. And those dates are, of course, we just had a training on the 7th of July. On August 18th, Angela Palm will be doing policy from GSBA. On September the 17th, we will have GSBA training. On October the 15th, we will have GSBA training. November the 19th, we will have GSBA training. Right now, I have December is open for us at some point to talk about if we want to schedule a retreat during that time. The reason that the other dates, the 17th, September 17th, October 15th, and November 19th do not have a specific topic anymore, is that with our Cognea report, they suggested that we do a self-assessment and then allow that to guide our professional development, set goals and objectives based on that. And so while there are several areas that came up during that training that I've spoken with GSBA about. So for instance, highly effective governance, basically the practices of highly effective governance, superintendent evaluation, team building, all of those are topics that we've tossed around as well as discussed in light of the Cognea report. But they also thought it best to be sure that we leave room for the results of that self-assessment. So if you would be sure to mark those dates, it's from 5:30 until 8:30. I know we've communicated at different times about those dates, and so you may already have them, but I wanted to come back and confirm those dates.
Could you repeat the Angela Palm date and time?
Yes, that one is August the 18th from 5:30 until 8:30.
That's the only one that's not on our calendar.
Okay, that may be because it wasn't confirmed. This was the date that I pulled from that second doodle poll where I saw that everybody was available. And so according to Ms. Palm, she is available. If something has happened and for instance, it does not work, all of our schedules, since it is supposed to be a whole board training, just let me know and I can, we can go back through, but we can go back through the process and find a date for August.
I'm sorry, Lakeisha, I know it's probably on the calendar. Can you just run through them one more time? So 8/18, 9/17,
10/15, and 11/19.
11/19?
Yes.
Okay, good. I think I do have them on my calendar already. Thank you.
And secondly, well, actually, I don't have my screen up. Are there any other questions about that? No?
I was just going to ask, the self-assessment is still on the 21st. Is that correct, of this month?
Oh, that's right. I'm sorry. Did I not mention that?
No.
Okay, I apologize. Yes, the 21st is still on our calendar. So that should have been the one that I mentioned after the 7th that we just had. And I think that one should also be on our calendar already.
It is.
Yes.
Any other questions or areas that I may have left out with that? Secondly, as it relates to the self-assessment, we will have to decide if we want to do the paper self-assessment that GSBA offers or has, or if we want to do it electronically. If we do it electronically, basically that consists of us purchasing a module from GSBA And we can each basically do it from the comfort of our own homes. Actually, even with the paper copy, we can just print it. But it also scores it for us and provides them with the information. With the paper copy, we would have to score it on our own and would have to synthesize that data and then send it to them.
How much would it cost?
The cost would be, give me a second, would be $1,750, so $1,750. And it would be through Assembly. And it would take, I think Julie said it would take about 1-2 days max just to get all of us as users loaded in to be able to use it. And we would be able to complete it. But again, there is the option to do the paper as well. We would just have to designate someone to synthesize that information for us.
If it's a paper copy, does it have a cost to it?
No.
Well, it seems like we should be able to take $1,700 out of our travel budget since we didn't spend it all.
Well, that's exactly what that budget is for. When you take GSBA training or whatever training, that's what the money is used for. So that's a good idea, Linda.
I really like the idea of the online version. If it's similar to things that I've used in my training, there's so many ways to evaluate the data and give you some really positive feedback that you lose when you're doing it manually if it's a comparable tool.
And I do think that there are benefits, particularly at this time. One is because it gives us at least tangible results that we can get in a shorter turnaround period, but then also with the board, with the paper copy, it would require, we'll probably need some administrative assistance because if a board member, it's just better to have someone sort of outside of the board to read all of those results and things like that.
Yeah. If you do it electronically, then it's going to be summarized for you. You're going to get some really nice reports with some graphs and things that'll be help interpret that data. So I think $1,700 is not a lot of money to pay for that. It's something that's that important.
I agree. That's the world that we live in. Why do it manually?
Mr. Knox has his hand up.
Thanks.
Dr. Knox, sorry.
That's fine, John. Yeah, I guess I just look at it differently because when I look at that money, I think of it as the taxpayers' money. If we have a manual option that would save us a little bit of money, that's how I would prefer to do it. I think we could probably find somebody in the district that's not on the board to maybe help with collection and scoring and or whatever needed to be done. That's
I can't
just my
imagine
preference.
this going outside of the district. This is board confidential, I would think. I don't think we want this outside of the district if we're doing
No, I
assessment.
meant within the district, like that we have employees that could maybe help.
I think I think that's a little bit.
Okay, I'm just trying to save money.
Yeah, $1,700 is that's not a lot of money. And this is something that our accreditation depends on in terms of us being able to build a plan going forward for our development. So why wouldn't we invest that small amount?
Because we have people for whom that is a lot of money that are our employees, but that's all. I'll go with the will of the board. Thank you.
Yeah, because go ahead. I'm sorry.
I was going to say, I've heard from Dr. Knox, Mr. Worthy, and Ms. Davis, I think. Others?
I would go ahead, Kara.
I was just going to say, I think either way would be fine. I think there are some benefits to doing it electronically. And also we had talked about Assembly as a product that GSBA has talked about as being able to do more things than what we can currently do with our current system. So if this was a way that we could kind of like try out one part of Assembly, if that might give us a little bit of a feel for how it works without purchasing the entire thing, then that could be worth it. But either way, I think is fine.
I would be concerned that it wouldn't obligate us to anything more. Right
And
now.
we as a board, we don't spend a tremendous amount of money. That money that is appropriated for board travel, it was cut several years ago, and it never did replace the total amount. And I've said this before, we either use it or you're going to lose it. And it goes back into the general budget.
I don't have a strong feeling either way. I'd like to know what we're getting for our money, but I trust Julie. She's been good to us so far.
Yes.
My opinion is I would assume if they're charging $1,700, there must be a lot of bells and whistles to it that will have, like Linda said, charts and graphs. And so I would opt for the electronic version.
Okay. Others that I haven't heard from?
I'm okay either way.
Is this something we would need to do before they come on the 21st? Is that why
Yep.
we need? Okay.
Yeah, whether it's the paper copy or
Okay.
paper or electronic, yeah.
Do you know what system it is? I know that it's housed in Assembly, but what kind of, do you know the name of the assessment?
I don't.
Okay.
But I do think on one of our calls we had we pulled it up. So I think it's public if it's the Georgia School Board Association's
Okay.
assessment. I can't remember right now. One thing I can do if you all would like me to, I feel that the electronic would, may serve our purposes better. But if the board, if you all want me to contact Julie or Dr. Rame and Dr. King tomorrow to see if they could we could set up a sample, more of a
demo or something.
Yeah, like a demo. I think that may be possible. And we decide as a board, neither here nor there. Either way, we need to have it done. And according to our Cognea report, we need to be able to set some objectives around the feedback that we're given.
I mean, I'm just pointing out we got 2 weeks. So
And here,
I think we need to go ahead and move forward on it, Dr. Gant. I don't think by the time we do a test, it'd be 3 or 4 other days. I just think we need to go ahead and do it.
okay. And of course, there's the option to, we've tossed around many dates, so I'm happy to go back to that all of our available dates, if we need to move it back as well, if time is the biggest issue. But I just, I really want to decide based on what the board wants. So again, we have the money. That doesn't always mean that the money should be spent on that. But as mentioned earlier, we do have that professional development money that each of us are allotted, and we're allotted as a board. So
I think it's one of the biggest and best investments we can make as a board.
Yeah, I feel the same way. And Greg can attest to this. That same money, when you travel to NSBA conference and all of the different sessions that you would attend, and also the exhibit, and just having dialogue with school board members from all over this country, it's worth it.
okay. Well, if there are no objections, I'm gonna move forward with did I hear everybody that wanted to say something?
I think the consensus is to go ahead and I don't want to change the date in July I think we need to just go ahead. We've got 2 weeks to do the electronic version, have it tallied in a few days, look at it, and then use it for our work session.
Okay.
Yes.
Well, I'll move forward with that. And I think the results, again, this was whether it was going to be electronic or written. I think we'll probably refer to these results throughout the next 6 months because, so we'll use it beyond that self-assessment training time because it will tell us all of the areas of strength, the areas that we need to grow in, that type of thing. So I'll move forward and contact Drs. Rame and King about that. Any questions? The third and final thing is that I had originally planned with Dr. Thomas to sort of deliver a brief presentation based on the conversation with the Cognea, the individual overseeing Cognea, Dr. Harris, I think. However, that has been postponed. And so I'll notify you. I don't think we need to wait until August, but I'll notify you when we are ready to give that report. A significant part of the report is more so like things that he shared as things that should be priority in the report. And basically how moving forward, our work needs to be aligned with the directives. And then I was going to give an update on our professional development calendar by giving those dates. And then I originally spoken with Dr. Yeager to give us an overview of the policy work that has been done so far and that we foresee in the future. But that won't happen tonight, and I will let you know when it will. Any questions?
John has his hand up.
Oh, okay.
Yes. So you're not making a report on that tonight, but we'll hear about it at some point.
Yes. Last week, I think Dr. Thomas and I began working on a PowerPoint with
Okay.
the key portions of that conversation, as well as notes that we had both made while on the call.
Okay.
And so, yes, that's right. We will hear about it at some point, and hopefully by then, I mean, these are things that we've talked about, but sometimes it's just helpful to actually see. I think
Right.
for us to see, and as well as the public to
Right.
see
Yeah.
the areas with policy, and actually just mentioning, I may actually need to follow back up with you at some point, Dr. Knox, as well as any other teams that have norms, because that's not policy, but we really want to be able to like update the public in a succinct manner on the steps that we've taken so far, and then
Right.
the steps we plan to take in the future.
Right. Yeah. All the different committees that are working on norms. Yeah.
Right.
I think that's right. Good. Thank you.
Other questions? We're here. Okay, we will move forward with our next item on the agenda, which is our superintendent's report. Mr. Gaskins.
Yes, ma'am. Thank you, Dr. Gant. Lisa, I'm going to take over the screen if that's okay.
Go right ahead.
So we do have a superintendent's report for today. Dr. Thomas wanted us to talk about our reopening updates. So we presented a version of this presentation to our principals and our executive staff earlier this week. We've modified it just a little with some feedback from those individuals. So what we want to discuss today is just give you an overview of Georgia's pathway to recovery for K-12 schools. We want to talk to you about the work of the task force so far, give you some COVID-19 updates, particularly what is going on in Athens and our surrounding area. We want to talk a little bit about our Department of Health guidance, give you some updates on what we are doing with operations and facilities, as well as instructional updates, and then talk about next steps as a district, as well as a task force. So the first thing, we just want to talk about Georgia's path to recovery for K-12 schools. So the Georgia Department of Education and the Department of Health develop guidance to support districts and communities in really helping us strategize plans for reopening schools. So they provided us with a tiered approach for clear actionable steps, which is built off their guidance of health officials. And then the guidance focused heavily on the health, physical, and logistical requirements necessary with reopening schools. And so this is just guidance. This is not something that is mandated by the DOE. So as you see on this slide, this is the tiered guidance. So if you look on the left side where it is red, it talks about if there is substantial spread. And it gives recommendations for what that instructional model would look like. So that is completely distance remote learning, and then what our response would be as a district. If you look at the middle, that is our minimum moderate spread. It would suggest that we have traditional hybrid or full distance remote learning or some combination of those three. And then it also talks about the response to school buildings being opened, limited or staggered use of school buildings, and also the minimal use of school buildings. And then over to the right in green, if there is low to no spread, then they would give us guidance around having a traditional school year with face-to-face instruction. And then we would implement preventive practices for additional proactive processes and protocols. So our reopening task force, we had 4 subcommittees, one that is focused on operations, one on facilities, one on instruction, and one on health, safety, and wellness. So the bulleted items under each subgroup is also based on the guidance of the Department of Health and the Georgia Department of Education. So they are suggesting, and what we've worked on is, what is our plans for transporting students and serving meals? So that has been tasked with our operations subcommittee. As far as facilities, conducting large group gatherings and entering school buildings. For instruction, it talks about transitioning, which is very important, especially at high school and our middle schools, supporting teaching and learning, and protecting vulnerable populations. And as the guidance defines protecting vulnerable populations, that is our students with medical needs, that includes our staff with medical needs and our students with disabilities. And then with health, safety, and wellness, practicing prevention, having guidance for when a child, staff member, or visitor becomes sick at school, and then our communication and community engagement. If you look at the chart on the right, it shows the members of our task force. We have district leaders, including our chief of operations, our director of technology, school nutrition, custodial services. We also have 4 principals that are represented on this task force, as well as assistant principals, as well as our athletic directors. Also a very important member of our team is Amy Rourke, who is our director of school nursing. So we wanted to give some context of where we are as a county in our surrounding area. So our risk level is being determined by the Department of Public Health, but we currently, as of today at 2:50, have 841 confirmed cases. And so we have over 100,000 residents in Athens. So cases per 100,000 is about 648. We currently have 68 citizens that are hospitalized based on their COVID-19 confirmed case. And currently we have 15 deaths in Clark County related to COVID. So we have some additional links that we encourage board members, and we will post this slide deck on our website for more source data so our community can see the daily status reports for our district and surrounding area. And this slide just also shows where Georgia is compared to Clark County. So As you can see, Georgia has over 96,000 cases to over 2,000 deaths compared to the cases. And this is just a little lagging data compared to the last slide as far as confirmed cases, but confirmed deaths is 15. So as a task force, looking at the guidance, we decided that we needed to have 4 health non-negotiables in place for a face-to-face concern. So one of the first things was having ample amount of cleaning and disinfecting supplies for our teachers as well as our custodians. Staffing, adequate numbers of staff to support students. So currently, as you all know, we sent out a survey to staff about being able to return to work. About 6% of those staff members, including bus drivers, school nutrition workers, and teachers, indicated that they are unable to return. The other thing that we thought was important for face-to-face is having masks for staff and additional PPE for necessary staff, including nurses and medically fragile individuals. One thing that I will mention later, but I think it's an appropriate time to mention it now, that we will provide PPE for all of our staff, but we will also make available face coverings for students that do not have them. Then the last thing that we wanted to consider is just making sure that we had a plan in place for what to do when an employee or a student reports a positive COVID case in the school, and plan how the district will respond to the varying levels of community spread as determined by the Department of Public Health. So some of these we are working very diligently to make sure that we have the ample supplies that we need. We have ordered and PPE has been delivered. We are developing a plan for guidance for when an employee or student is sick. Our staff survey closes tomorrow, so we will be able to have exact numbers of the number of staff that will be able to return. So some of the health and safety recommendations that we are making, that when we return face-to-face, we want to ensure that staff and students should remain home when they're sick. We also, all students and staff will be required to wear face coverings, and there's an article that is attached about helping slow the spread. We will work on socially distanced classrooms and building spaces, an emphasis on hand hygiene, respiratory etiquette, practicing illness prevention, providing signage in all of our schools as well as our buildings related to social distancing. We are also encouraging temperature checks at home of our staff and our students and on site if recommended by the Department of Health. Our school nurses will be our COVID point of contacts, and we will have quarantine spaces in every building. So if we suspect that a staff member or a student has COVID or has the symptoms of COVID, then each school and district space will have a quarantine space for that individual, for their parent to come pick them up or their spouse to come pick them up. So when a child, a staff member, or visitor becomes sick, again, we will identify an isolation room or area to separate anyone who exhibits COVID-like symptoms, establish protocols for safely transporting anyone who is sick home or to a healthcare facility, notifying local health officials, staff, and families immediately of a possible case while maintaining confidentiality, close off areas used by the sick person for cleaning and disinfecting, and then advising students and staff who came into contact with that individual to follow up with appropriate DPH guidance or stay at home as recommended. Something that we are very excited about, and Amy Rourke, our Director of Nursing, has done an amazing job with this. Our Hillsman Health Clinic, we opened on July 6th as a wellness clinic. So the wellness clinic will serve all students and staff across the district. So these are not sick visits, but these are visits for immunization, well visits, sports physicals. They will provide COVID antibody testing And then we are looking to schedule a mass COVID testing date for CCSD staff and families. And so as we reopen the Hillsman Health Clinic, this is just not for the students at Gaines or Hillsman Middle School. This is open by appointment only for any student and staff member in the CCSD community. The other thing that we've added with the approval of the board in our budget is a telehealth nurse. That telehealth nurse will be able to go from school to school and be mobile and do COVID testing if needed when the school year starts. So as far as our operations and facilities updates, we talked about areas of consideration as we continue to improve these areas, practicing of prevention, transporting of students, entering school buildings, serving meals, which is very important, as you all know, student transitions, and then of course, conducting large group gatherings. So with practicing prevention, we want to ensure that we teach and reinforce good hygiene measures to all of our students. We will provide hand soap, hand sanitizers, paper towels to frequently trafficked areas. We will post signage of COVID-19 prevention and symptoms, good hygiene, and school district specific protocols. We will clean and disinfect frequently touched surface areas. We will turn off water fountains and add water filling stations throughout the building. And we will conduct deep cleaning daily before school opens each day. And based on our instructional model, we will also have Friday to also do deep cleanings. As it relates to transporting students, we will have hand sanitizer for students and bus drivers. We are providing gloves, masks, face coverings to bus drivers, and face shields. Students will be required to wear face mask coverings on the bus. We will utilize space seating when possible. We will eliminate field trips, clean and disinfect daily touch surfaces on the bus, and establish protocols for bus stops, loading and unloading for students to minimize the congregation of children from different households. As far as entering the building, we want to make sure that we post signage of the COVID-19 prevention and symptoms and good hygiene and our school system protocols. We want to designate entrance and exit flow paths for each building. We want to establish a protocol for visitors, requiring them to use face coverings and restrict non-essential visitors and volunteers, and then establish a protocol for student pickup and drop off. So with serving meals, our protocols will really be around requiring and encourage students to hand wash before and after meal service. Again, providing hand sanitizer for students and staff, using disposable plates, utensils, and other similar items, adding signage to the entrance and exit flow paths in our cafeterias and serving lines, conducting cleaning of our cafeterias and high touch surfaces. We will have grab and go breakfast in the classroom for in-person instruction. All students will go to the cafeteria to select their prepackaged lunch menu to take back to their classrooms or in another area of the school. And then for traditional students, we will send home Friday meals with students on Thursdays. So in our instructional design, Friday will be a digital day. So we would send students home with their meals for Friday. And for those students that are not having in-person instruction, we will have curbside grab and go meals for those students. So with student transitions, really important, especially at our secondary schools, limit congregations between groups and grade levels. We will provide additional time for transitions, have designated signage. We will stagger class changes, and then we will have signage describing 6 feet social distancing. So with conducting large group gatherings, we will follow the governor's executive order around abiding by the maximum number of people allowed to be in a group. We will discourage the congregation of students in parking lots and common areas. and then we will follow GHSA guidelines for athletic events and practices. So with supporting teaching and learning, we have a lot of buckets in teaching and learning. One is our Office of Early Learning, pre-K in our elementary schools. Another bucket is our middle schools, high schools, and our alternative school, as well as program, our Athens Community Career Academy, dual enrollment students, extracurricular activities, and then I want to share with you some additional instructional considerations. So as you all are probably aware, we are offering currently two options for our Office of Early Learning pre-K and elementary students. So option one is in-person instruction that takes place from Monday through Thursday, with Friday being designated as a digital learning day for all students. So in this option, bus pickup and our school start times may be impacted or will be impacted to achieve social distancing for bus riders. So based on guidance in collaboration with Mr. Weaver, who is a part of our task force, we are able to get 48 students on the bus when those students have face coverings on. So we know that our buses will need to make multiple runs, and that will impact our school start times. The other option is our distance digital learning. So we will provide live and video recorded instruction. So this is a major commitment from families because some of the things that students will do, they will need to do independently, and we will need the parent to ensure that those things happen. These students will engage in both on-grade level and supplementary materials based on their academic needs. And we will require at least 3 in-person visits at their home school during the first semester. So those in-person visits would include a diagnostic assessment, so we will know their level. If we have any interim assessments that need to be given, we will want them to come in for that. One thing that we want to communicate to parents so we can make sure that this is very successful is that if students pick the distance or digital learning, we would ask for them to stay in that model for 9 weeks. And if that model is not working for them, after 9 weeks, they can change to the in-person model. So with our middle school, option one is similar to our elementary school. Option two is a little different. So in option two, we will utilize Edgenuity and we will adopt the model that is being used at Classic City High School and the model that we use in our high schools for summer school. So students will, who are opting for distance and digital learning, they will be assigned to an Edgenuity course, but they will have a live teacher that is also assigned to them. So in the blended model, they will meet frequently, at least twice a week with their teacher, if not more. And they will progress through the Edgenuity model. We are asking our secondary schools to have 4 in-person visits, just so we can make sure that they have opportunities to take their quizzes and unit assessments, as well as their diagnostic assessments. High school has 3 models. The first model is a hybrid model. So hybrid means that there will be some in-person instruction and there will be some distance digital instruction. So in our hybrid model, our students will be on an A-B group rotation. So we currently have about 1,800 students at our high schools, and our high school leaders were very uncomfortable with all of those students coming at once based on the needs for social distancing. So we would try to break those students into 2 groups, with one group coming on Mondays and Wednesdays and another group coming on Tuesdays and Thursdays, with all students receiving digital learning on Fridays and the days that they are not in school. Option 2, being fully distance and digital learning, we would mimic our Classic City High School and our high school summer school model by assigning a teacher to those students working through Google Classroom and Edgenuity for those students. Option 3 is that we do have a policy around Georgia Virtual School. So students can elect to enroll into Georgia Virtual School as an option as well. We have limited seating in Georgia Virtual School, so we are making it available as a priority to our juniors and seniors because it does take a large level of independence and maturity. However, we will approve any student that wants to attend Georgia Virtual with the approval of school administration. So some additional instructional considerations is that we're working with our partners at Athens Community Career Academy to follow some safety protocols for our students as it relates to instruction. And so we're currently working on that plan. As you all know, they do not currently have a CEO at our Athens Community Career Academy. So Lawrence Harris, Dr. Neil Crossland that supports our secondary schools, we are working collaboratively with them to have a plan for those students as well. With dual enrollment, any student that is in a dual enrollment course that is not on our campus, they will follow the enrollment expectations of that college or university. As far as athletics and extracurricular activities are involved, again, we are following the Georgia High School Association guidelines to prepare for fall sports. We are planning to allow cheerleading, marching band, and JROTC to begin in the upcoming weeks following those same guidelines. All other in-person extracurricular activities will be delayed until additional safety guidelines are established. The other thing that we are considering is our after-school program in PSP. So we are exploring the need for after-school programming in PSP, which we included in our survey to parents. Our after-school programs are largely staffed by students at the University of Georgia. And so we just need to have more information about how we can support that program as it relates to staffing. So our principals have just come back on contract, so we will be engaging them in that conversation. So in this chart, I just wanted to show that some additional considerations and recommendations that we will make to Dr. Thomas is around a proposed delayed start date. So we've surveyed our families. That survey ends on Monday around delaying that start date to August 17th or to September 8th, which is after Labor Day. If we do have a modified start date or delayed start date, the school calendar may be modified, meaning the staff working calendar will not change. We will use that time to train our teachers and provide professional learning so we can really support our students in a virtual environment. And May 20th will still be our last day. We may have to modify some of our conference days and some of our student holidays to make up for the loss of instruction. Again, bell schedules will be modified to accommodate social distancing on the bus, and our plan is to have open house will be virtual. The middle column talks about our core instruction and unfinished learning. So we acknowledge that students did have instruction from March through the end of the year, but there are still some areas of unfinished learning. So tonight, we will be recommending a supplemental software that will be available to all K-8 students to support unfinished learning. I just wanted to clarify that this software is for in-person digital learning. So it's for all students, just not those students learning at home. And it also has print materials for those students that don't have the appropriate devices. Also for K-5, we want to make sure that we have a focus on reading, ELA, and math as we move forward, with Friday focus on social studies, science, and our special classes such as art, PE, and music. The other considerations as it relates to distance learning, which I think is important, is that we will use model teachers to plan digital lessons that support the core curriculum for all students. Based on student needs, teachers will be assigned as virtual teachers. I know there's been some conversation about teachers being able to teach virtually, and that is something that we're interested in doing. But first, we need to know the needs of our students to see if that is something that we can support. And then just the last thing that we just wanted to make sure that is different is that students will have clear check-ins with the teacher and adhere to attendance expectations. In March, we were more forgiving around attendance. We will have to make sure that we have some really clear attendance expectations and communicate those to our parents and our families. So as far as next steps are concerned, we want to ensure that all communities contribute to the survey. We look at our survey daily. We had a task force meeting, our second task force meeting of the week today, and we know that there are some communities who have not contributed to the level of some other schools. So we're reaching out to those principals as well as working with Lawrence Harris to implement some strategies so we have their feedback as well. So the task force, we will review the surveys and make a recommendation to cabinet and Dr. Thomas regarding a school start date. And then based on our recommendation, we will also make a recommendation of a new school calendar. So based on our results, we will design our final distance digital learning framework to share with families. So we are aware that the results may impact the registration timeline. So we have given a small window for parents to register. We want to be flexible in that registration timeline to make sure that parents feel comfortable with whatever instructional framework they pick. And we want to be able to provide some additional guidance for our students with disabilities as it relates to those frameworks. And then the last part, we just want to implement professional learning plan that focuses on staff and student safety and distance and digital instructional design, of course, with teacher collaboration and input. So our task force, we meet very regularly. We are probably going to meet 2 to 3 times next week. It is very difficult as things continue to change to make decisions, but we have a great task force that is up for the challenge. So that is the report. And at this time, I'll take any questions that you have.
Yes, Mr. Gaskin.
Yes, sir.
Let me say right away, amazing planning, amazing. I really congratulate you all out on that. Now, as far as items for board approval, I know you mentioned about, I think I got this correct, a telehealth person, which would be a nurse, and additional money would have to be put into the budget for that. And then, of course, you mentioned some changes in the school calendar. Are those the only 2 items that you would need board approval on?
You actually already approved the telehealth nurse at our last, during our regular budget. So we appreciate that. We are not ready to make a recommendation tonight around our start date or our calendar, but we do anticipate with collaboration with Dr. Gant, Dr. Maddox, and Dr. Thomas, maybe having a call meeting where we would need to bring that forward for approval in the very, very near future. The item that we have on the board doc tonight as it relates to our distance learning is around our supplemental resource, Curriculum Associates iReady. So that is what we have on the board agenda tonight as it relates to our instructional framework.
Well, again, amazing planning.
Thank you.
I commend you all.
I believe Dr. Knox has his hand up, Mr. Gaskins.
Go ahead, Dr. Knox.
Thank you. So I've just got a few quick questions. Yeah, I think you just answered one of them. The K-8 software supplement, that's the iReady?
Yes, sir.
Okay, and that's the only software we're talking about tonight is?
That is the only, yes, sir. That is the only software that we're talking about tonight based on board, that needs board approval. Okay. That will not be the only software that we use to supplement. Yeah, so understood. For example, Mayan is a digital library that students can read unlimited books is something else that we will be purchasing as an example.
Okay, good. That's fine. I just wanted to make sure, since it's getting a little late already, and I didn't want to ask people too many questions later. So your task force sounds great. Are there any current teachers on it?
We have 2 athletic directors on the
That's
task force. We don't have any classroom teachers.
Okay.
What we've asked our principals to do is make sure that they to make sure that their teachers know that they're on the task force and bring any concerns that they have.
Okay.
We receive a lot of emails from teachers, and we try to respond to those
Yep.
emails as quickly as possible.
So it goes through the chain of command, is what you're saying.
Yes, sir.
Okay, the 6% that responded and said that they couldn't return in person, you're going to get an updated percentage based on the survey results that are due tomorrow? Is that right, or not?
That is correct.
Okay.
So what we plan to do is send out our current results to principals to make sure they have principals and department heads to make sure they have 100% of their staff responding. So we have actual numbers to continue our planning.
Good. I think we'd all like to see that. Something that's happening at UGA is that we're all asked as instructors to pick teaching buddies. In case we go down, somebody else covers our class. Is that part of any plan here at the K through 12 level, or is that something that substitutes would do? I'm just curious.
I was just thinking about that through public comment. Dr. Knox, we have not, I think, totally planned about what will happen when a teacher is absent. I have some ideas. I would like to kind of share those with the task force, so they're just not an ideal of one. But I do think that we have to have a plan, because I think it will be obvious that we may not have as much substitute teacher support as we've had in the past, which we acknowledge. So our teachers will have to kind of stand in for their colleagues, and we need to have a plan for that. So
yeah, I think we're going to see some of that. I think it's probably inevitable that we'll see some people subbing, not substitutes necessarily, but having people that are going to have to do double duty. And just very quickly, I just wanted to say a bravo to the Hillsman Health Clinic, the health center. That's one of the things, as I get to the end of my term, that's one of the things I look back on and think, I'm really glad that we did that while I was there, even if I didn't have anything to do with it other than just voting for it. And so I think that's one of the shining points, and it's showing it right now. We really need that kind of service. And we actually built a new building and put the health center in there. And so hats off to everybody that was a part of that, including Dr. Means. Thank you.
Yeah,
thank you.
he did it.
Mr. Davis?
Yes, thank you, Mr. Gaskins. I have a kind of a series of questions, and they could obviously touch on the financial ramifications of it. But you talked about face masks for staff and having face coverings available for students. Are we talking about? This is an area that I've been very involved with, the last few months because of my own medical issues with my family. What kind of, are we talking about one 95 N95 mask per week for teachers? Are we talking about face coverings for students that would be, that would get one a day, or if they try to go on the bus without one? I want to make sure that we've got the supplies there for the face mask, because there are certain shortages that I'm reading about, and I hope that we don't get caught up in it. And the same thing kind of goes with the hand sanitizers. What I found out is antibacterial hand sanitizer is cheap. Antiviral hand sanitizer is very expensive. And so I want to make sure that the economic resources and the supplies are there for that. And then in terms of the testing, I know that there's a lot of controversy about, do we have enough tests? Do we test enough? Is the testing something that's being provided to us by the state, by the health department? And is it do we basically have what we need in that score? Or because I don't want to have a start school and find out that we're scrounging around, you know, a month into it. And so those are a series of questions I have. And the same thing goes with gloves. I mean, you know, I'm buying boxes of gloves and I'm buying all this stuff, and the prices keep moving up and up and up because the demand is there. And so I want to make sure that the economic resources are there and the supplies are there before we start this big adventure.
I think I'm going to, well, first, I don't think I have the answer for you as it relates to the COVID testing. I will have to follow up with Amy Rourke, our director of school nursing. So I can follow up with the board in writing tomorrow regarding that question. And I'll defer to Mr. Fisher around the mask and additional PPE.
Mr. Gaskin and also Mr. Davis, let me interject this before we leave it. You mentioned about the hand sanitizer. I don't know, about a month or two ago, I had one of my former parents to call me and said that, of course, her son was principal for her son, and another gentleman that graduated from Cedar Shores. But anyway, they own a brewery company in Atlanta, and they were willing to, in fact, they're making hand sanitizers. I think we're all familiar with, you know, in terms of the brewery company. But anyway, in short, let me just say this. I had her to call Dr. Thomas, but I know Dr. Thomas is here now. I will give her a call tomorrow and see whether they can still supply the school district with some additional hand sanitizer. I'll do that tomorrow.
Thank you, Mr. Worthy.
Let me go ahead and comment. Thank you, Mr. Gask. And Mr. Worthy, to your point, we have already secured that hand sanitizer from that company in Atlanta.
Oh, great, great.
Yeah, we did that several months ago. Mr. James Green picked those hand sanitizers up. So we do have that. We have already secured face covering for all of our staff. They'll get one apiece, which would be cloth. We ordered over 3,000 face covering for our staff. We're in the process of ordering cloth also for all our students. And what we hope to do is, well, one of the things we're gonna hope if the parents can provide face masks, which is good. But if a student does not have a face mask, we will provide one for them. All our bus drivers will have face masks on their buses. So if a student gets to the bus stop and does not have a face mask, we would give them one before they get on the bus. We have secured gloves. We'll continue to secure face masks, and we're also securing hand sanitizer. So we started this process, Mr. Davis, months ago, anticipating that this may be, that we're gonna need these supplies moving forward. So we had to open up our school tomorrow. We'll be ready from that standpoint. We got face shields for our bus drivers, face shields for our custodian staff. So we've really been planning to make sure that, you know, if we get our kids in, we get our staff in, we want to do everything we can to make sure that our school is safe and have everything that they need to have a good teaching and learning environment.
Mr. Fisher, when we get started, if you see that you are going to run short on that hand sanitizer, let me know, because this parent said they want to help in any way they can. So just let me know.
Well, I may be calling on you if we get short, but and like you said now, you're right, Mr. Davis and Mr. Worthy, the price does keep going up. And that's that is a concern of ours. I do want to thank Chris Griner. We do have monies from the CARES Act that we would be using to secure other supplies that we're going to need moving forward. Also, the equipment that we're going to use to sanitize all our classrooms and buses, you know, we're purchasing those type of items also. So again, we're doing everything we can to make sure that we have everything in place if and when we start school.
Thank you.
Dr. Yeager?
Thank you. I participated in a GSBA training on Tuesday. I think a couple of the other board members did as well. And one of the, or two of the things that they talked about that I did not see in your presentation, one was addressing trauma and social and emotional learning and mental health of the students, because a lot of them have family members who've died, or they have family situations at home that are not optimal, and they've had a lot of time at home and it hasn't been so good for them. We heard from a woman who was in Connecticut during the worst of the New York, Connecticut, New England trials this past spring, and it just sounded like the kids really needed a lot of extra emotional support, and I didn't see that in your presentation. The second thing they talked a lot about was having a communication plan, that having very clear ways of transmitting information, two ways, not just one way, but two ways between the community and the families and the teachers and the district, is a really important part of this returning plan. And I didn't see a whole lot about the communication plan either. Could you address those two pieces?
Yes, ma'am. So Tessa Barbazon, she is our director of counseling. She comes back on Monday. I just had a meeting with my executive team around that same topic of trauma and mental health, and making sure that we are utilizing our SEL curriculum, which is second step. And we're also piloting a SEL curriculum at Coyle Middle School. I just can't remember the name of it right now. So as we design our instructional day, we want to make sure that there is time for our SEL. So that is something that we have not created our final plan for, but that is something that came up just yesterday when I met with my executive team. So I think we're right on the same page with that. As far as our communication plan, Dr. Maddox sent the article to the board as well as myself yesterday, and that had really good information around just really the whole project management of reopening schools, and it talked a lot about communication. Beth Moore is our communication manager. She's also a part of our task force. We acknowledge that we have not had the best communication, so we are looking at some additional ways. Lawrence Harris is working with Beth Moore as well as Harold Faison on some additional communication, two-way communication, to your point, Dr. Yeager, in the future. We will have some additional communication later this week, some infographics that we are going to share with our community. We're also going to post I believe what Ms. Moore said was a form where parents and teachers can actually go to our website and give us feedback, so we can have it all in one place instead of them emailing, not knowing who to email. It goes to one place, and then Beth will assign a cabinet member or an appropriate person to respond to that. So those are some of the things that we're putting in place, but I know there are other things that maybe Beth can speak to that we can do more of.
Thank you.
You're welcome.
Mr. Gaston, go ahead. Mr. Gaston, one thing I make sure I've gotten many calls, phone calls about about the software, the online portal. I know you said that teachers, our own teachers, would be using that, and there will not be an outsource of a company doing that work. So will they be teaching with that software during the week as well as when the students are doing it? How does that work?
Excuse me, we can't hear you, Tawana, because Mr. Worthy's video is not muted, or audio is not muted. He's making some noise from his section. Can you mute Mr. Worthy, please? I'm sorry to interrupt.
Dr. Maddox, would you mind repeating your question? I think I heard it, but I just want to make sure I'm answering it.
I just want to understand. I've had a lot of concerns. One, about the teacher's role in distance learning and using the software, the distance learning platform that we are going to approve tonight. I just want to understand, will those teachers be teaching with that during the course of the school days as well as working with distant learning students as well? Who work with the distant learning students?
Let me answer both of your questions. So the first question is really around the software. The software is supplemental. It is not meant to take the place of the teacher. It is really used for, it can be used in a learning station. When an in-person teacher breaks into small groups, students can rotate to the software and work independently on their iPad or on their computer. If students are working in a digital environment, a teacher can assign lessons, or they can just work through their pathway for like 25 minutes or more, or a teacher can assign it for homework. So since it is supplemental and it adjusts to the student's level, it is something that students can do independently. As far as the digital learning is concerned, one of the things that we want to make sure is that we have a need for virtual teaching. So as I look at the results, it's not the reason that we send out a survey, because it's kind of hard to know how many teachers you will need for virtual learning unless you know how many students have signed up for virtual learning. So based on our current results, we have a lot of parents that are going to elect for virtual learning. And of course, we will have our teachers teach the virtual learning courses. We just have to decide where those teachers will need to be. It's very complex. So are a lot of those students at elementary school? Are those students in high school? Is it an AP course? So it's hard to say that half of our teachers will be virtual teachers, but we are confident in saying that because we have a need to teach virtually, that we will have a large portion of our teachers that are virtual teachers.
Okay, thank you. The other thing is, with my district, as I've already explained about the technology, making sure that it's equitable and that people who are in the rural areas, that they, that we are communicated as a board, also as the community at large, what is the plan going forward, or will there be an opportunity for a plan to, for you all to develop a plan to make sure that every family who does not have technology will have access to technology?
Yes, so I neglected to say, when Mr. Worthy asked, there's another item on the board for approval, which is additional devices for our K through second grade students. So iPads for our kindergarten and first grade students, and Chromebooks for our second grade students. Also, Hope McGuire, who is our director of Title I, is purchasing additional hotspots for students and families. And also we have CARES money that we are using to provide additional technology for our students.
And if I could butt in here, nobody minds. Mr. Gaskins, I wanted to just start off by saying I have requested a special call meeting on July 7th. I hope my colleagues join me on that, because I believe a lot needs to be discussed between the representatives of this community and the administration on these plans as they are developed. One thing I believe that we should be looking at is similar to what a lot of school districts across the state are doing, is they are delaying school returning until after Labor Day to watch this situation develop. Because we're in a situation now where schools closed on March 12th. And then cases were 0. and we now stand as of today at 841, according to the Department of Health. And in Area E, which Athens serves the two major hospitals for a 12-county region, we have a shortage of ICU hospital beds. So I believe the rush to go back to school has really disappointed a lot of people. And I believe there's a lot here that really needs to be discussed that can't really be discussed tonight. So I hope my colleagues will join me in requesting a special session here and so that we can really go in depth and collaborate between each other on these plans going forward. So.
Mr. Gaskins, I have a couple of questions. You mentioned in the presentation that there was a second column that said unfinished learning. And so there would be some additional supplemental materials purchased to help with that unfinished learning. Would that be iReady, which I know is later on the agenda, or is that something totally different with the unfinished learning?
That is part of what iReady provides. So it gives a student a diagnostic assessment to know where they are academically, and then it creates a learning progression so it can remediate those skills that they did not master in the previous school years. So it would be iReady. We also have in our, and I'll be doing a training with our principals on Monday around something called coherence mapping. So it's not a product, but it is some professional learning that I will provide our principals to help teachers understand that if we teach on grade level instruction and a student struggles, this is the standard that you go back to provide that remediation and not try to teach everything that they didn't get from March into May. So coupled with the iReady, there's some professional learning that we're going to provide our principals as well as our teachers around making some sound instructional decisions so we don't turn our first semester into a semester of remediation, but a semester of on-level teaching and having the appropriate supplemental resources to support that.
Okay. Thank you. And with the, with iReady, as well as all of this sort of seems to intersect some type of way with the likelihood, from what I think I hear you saying, that the proposed start date will be further out. Might iReady be, if it is something that we need to think on more? I know that you sent out, I didn't open it, but I think I saw the title of it, the overall like RFP information, but I also know that inside of our packet, you gave us the a very, very thorough, I guess, report, or it's a response to the RFP. And so I guess my question is this something that can be looked at a little bit longer? And if we do need to take a work session, or I know you've mentioned also a call meeting along with Mr. Stevens that I do agree will be necessary, how will it impact things like professional development and planning?
Yeah, that would be my only concern, Dr. Maddox, is the professional learning. We want to make sure that we schedule that as soon as possible, and we work that into our professional learning calendars for staff. So I think that is important. I think the other thing that is important is that as we design what our instructional day looks like, it will be important to include that in part of that instructional design. iReady does recommend, all of our programs recommend a minimal amount of time that students should be engaged with the resource. So we could delay it, but it might be hard in our planning, our instructional planning for teachers, and it might be difficult with the availability for professional learning, depending on when we would approve it.
Okay.
So I just have a clarification, if I may. The iReady, is that software that we had before?
We had two schools pilot iReady. That was Alps Elementary School and Gaines Elementary School. So those were the only two schools that have used iReady. iReady did provide free access to their platform. During the closing, several schools used iReady, and they also provided free Blackline Masters, and we used it for our work packets.
So again, it's a comprehensive tool where it not only does assessments, but based on the curriculum that you've outlined for your school, does it incorporate that as an add-on, or does it have its own internal curriculum?
Its curriculum is aligned to Georgia standards. So it has lessons and modules built around our current Georgia standards. So it does a couple of things. It has an assessment. It has the personalized learning path based on that diagnostic assessment. It's also used as a universal screener, which we are required to have for all of our students. And the other thing that it has, which is very helpful, is that it has what's called standards mastery. So standards mastery is equivalent to an interim assessment. So throughout the year, we can implement a standards mastery for students to see how they are progressing towards the Georgia standards. We think, and I had an assessment meeting today, that this might lower the number of assessments that are required for our students. So we're not requiring unit post-assessments. As you all are aware, the governor is asking for a waiver around state testing. So this would be an assessment that students would get on, like they would get on their personalized learning path on one day. And instead of it being their personalized learning path, it would be their standards mastery assessment, which would take about 20 minutes to do. And then we would know how every student is progressing on those on-grade level standards.
So I really like that this is individualized, right? So every single student in our school system will actually be able to know exactly where they stand, or better still, teachers will know exactly where they stand, and then kind of try and customize the learning around that, or the instruction. This is something I've been waiting for a very long time. So thank you very much for this.
And I neglected, there's one other part, there's a teacher toolkit. So when it gives the teacher this, when students take their diagnostic assessment, there's an option to group students. And so teachers can also provide small group instruction. So instead of a student just doing this on the computer, now it has pre-prepared lessons that teachers can implement in their classroom for small group instruction that can be used after school, before school. These lessons can be printed and shared with parents if parents want to provide some remediation that's not on the computer, but more hands-on with manipulatives. That's also an option that it provides.
I'm really excited about that. So what kind of training is this going to be for our teachers?
So we have to get it approved first, but it will be, they have a virtual, a lot of our partners with textbooks are doing a virtual training. We've done the training with Gaines and Alps before. It is multiple trainings over the year. So they train you to use the system, and then they help train you to interpret the data once students have the diagnostic. And then they also offer an additional training around using the teacher toolbox, so you are aware of all of the resources, the supplemental resources that you have as a teacher.
So did the Alps and did you say Gaines, did they use this last year?
They did.
Last school year? And so how did it contribute to their increased scores?
So that's a great question. I might be in the minority of wanting our students to have taken the milestones, but we were predicting really big gains at Gaines Elementary School and some increased gains at Alps. Miss Oloko, Audra, the principal of Alps, she very much has called me a lot about us continuing to use it. So even if it wasn't approved, she asked if she could still somehow use it. I got feedback from Dr. McDaniels at Gaines. His teachers have really taken to it.
That's great. That's good to know. And I didn't look at all of the test scores, but I looked at some of the milestone data. Are we going to get some charts on that? This is kind of totally off the subject, but at some point, can we get that comparison for our school so that it's just kind of condensed just for us? Or did we already get that? I don't remember seeing that for last school year.
We don't have milestone scores for last school year. The
CCRPI maybe?
We
No,
won't have
nothing?
CCRPI either.
Okay. All right, thanks.
Dr. Dykeman, Dr. Knox, and Dr. Yeager, did I see something fly across? Okay, maybe it was on my screen.
It's Greg, I think.
I have a lot of questions, but we don't have to necessarily answer them all tonight. I think I also would be in support of having another meeting specifically just to talk about some of these reopening things. But there were some things that came up a lot in the public comment and things that I've been asked a lot. And you kind of addressed it, but I wanted to just be clear. Given now that you know that there will be students who will be wanting the digital option, there will be CCSD teachers who will be then assigned to digital teaching, virtual teaching. Is that the case?
That's correct.
Okay. And they will not be teaching face-to-face at the same time?
They would not be teaching face-to-face. So we talked about this today on our task force, Dr. Dykeman. So for example, we could, if you had 4 kindergarten teachers, you could split those students who are face-to-face between 3 kindergarten teachers, which those numbers would still be pretty small, and then have 1 kindergarten teacher that would teach to those other kindergarten students that are in a digital environment.
Okay. And so that kind of leads to my next question. And I know you don't, well, okay, no, before that, I know that this in the staff survey, the possible options for, are you able to return there were just 2, I will be unable to come to work and I will be able to come to work. And I guess I'm concerned that either the teachers didn't fill that out, which I guess you said you're going to have principals follow up with them, or teachers said that they will come to work because they were afraid that if they said they wouldn't come to work, that they would have to take unpaid leave, even though they would prefer, if possible, to do the virtual learning because they're high risk. Does that make sense? Like that third thing wasn't an option. And so I think that if somebody were high risk, they may have said, I will come because they don't want to not have a job.
Yeah, we've reflected on that. I don't know if I have an answer for you, Dr. Dykeman. I think one of the things.
You don't have to answer that. I guess I'm just concerned that the results you're going to get are not going to be accurate, so that there may actually be more people that would be available for virtual teaching than it may come out in the survey.
Lynn, do you want to?
Yeah, I've spoken with a lot of principals and they are in communication with their staff. And I've advised them if they have an underlying condition and are leaning that they, don't really know what to do. I've said, say that you're not coming back so we can go ahead and plan and maybe find a space that you're more comfortable with teaching virtually. Because if you're trying to figure out which one you want to do, the odds are you're not comfortable about coming back, right? So we want to try to work that out where we can allow people that are in compromised groups to teach virtually. And so we'd rather know that way. And so they're meeting with their staff. I think almost all of them did this week to kind of go over, logistics and talk to people about what they're doing. And so I talked to a principal today and she said, all of my staff have said they're coming back. And I said, well, I see one has not, and this is the one. And so she reached out to that staff member. So a lot of that's going on as well.
And then related to the split between, who want digital and in person, but this would be more for students. do you have a sense of what would be the, say for elementary school classroom, like what would be the maximum number of students that could come and be in a classroom?
Are you speaking about the class size?
Yeah, like in terms of trying to keep social distancing and just logistically, is there a limit to the number of students that we want in the classrooms? Because otherwise it kind of just makes it like we're all just going back as normal.
That might be a question I will need to research a little. I would probably say no more than 15. I don't know if that's the right number or not. I would say about 15. It might be a little less at first grade and kindergarten. A lot of those classrooms don't have desks. They have tables and carpets. So it might be more of 12 at our early grades, but I think that we could probably socially distance with class sizes of about 15.
We've all, Dr. Dykeman, I had my staff to go out and look at classrooms.
Okay.
See how many from 6 to 8 feet, how that would look. And Mr. Gaston's right. We can go anywhere between 12 to 15 students safely in a classroom.
Okay. Oh, and my one more question before I'll save the other ones for another time, but and hopefully we will delay so we have more time to figure all of this out. In the first letter, I think to parents, it said that masks would be required, and then in the second letter, it wasn't as clear. So will students be required to wear masks, barring any medical condition where they can't?
What we said was where social distancing wasn't wasn't required, then they would be required to wear a mask. Now, if they get on a bus, they're gonna have to wear a mask on the bus because it's gonna be a little bit difficult for us to social distance on the bus. But if they're in a classroom and we got adequate social distance, they wouldn't, according to CDC, they wouldn't need to have on a face mask. If we're transitioning in the hallways, then we would expect them to have on face masks if they have to transition from class to class.
Go ahead, whoever was next.
Mr. Davis.
And I do agree with Kara that I mean, I would feel a whole lot better if our teachers who felt comfortable were back in the schools making these plans. Unless they were, just an extended pre-planning period that went into a number of weeks. But one thing that when you check back with the testing, Mr. Gaskins, if you would also look into, there's different types of testing, and they have different times of when you get the results. And this has become a very kind of controversial area. There are tests now that they're even questioning whether or not they're really effective or not. And so if we listen to the guidance of the health professionals, testing, it's kind of contrary to what we're trying to do in public education, where we're trying to move away from tests, but here we want tests. And so how long we have to wait for the results would be critical. To circle back around to what Tawana said, on our survey, even though superficially it looked like that, 94.8% of our families had internet service, only 29.2% said that they had it without difficulties. And so that's really concerning to me. And one thing that wasn't in your presentation that would be a budget item is that if we needed to expand the technology staff, because I don't know, do we offer kind of a hotline for parents who say, you know, I've signed up for this digital learning and we live north of, we live over there by Coral Middle School and it's fading in and out and we don't know what's doing it. And we call the cable company and they put us on hold and you know, do we have a technology? Because I know the technology staff is fairly small, used to be bigger. And I'm just wondering if that's a budget item that we need to maybe expand our technology staff to be able to help families. Because it sounds like even if they're opt to go into face-to-face learning, on Fridays are going to be technology day anyway. And so it seems like that's an area of a budgetary item that we may need to explore. And then the last thing is in terms of the digital teaching. You know, a budgetary item may include the training of these teachers, because as parents have shared with me, like I know all board members have had parents talk to them about, you know, well, the digital learning here was good, but not so good here and that type of thing. Teachers, if they are assigned to do digital teaching, there's an art to it. I mean, it's a different can of worms. And so that may be a budgetary item where we actually have to spend resources training our teachers to teach digitally. And it seems like that all teachers will be doing it in one degree or the other. And so anyway, those are three budgetary items that I would be interested in finding out more about, and to see if what assistance that we as a board could provide you in terms of resources. Thank you.
I appreciate that, Mr. Davis. We have thought about how we can compensate some of our teachers that are pros in this already and provide training. So in my budget, we have additional money for additional work agreements and pay for our current teachers that are doing this work that we could pay them for planning and then have them redeliver their expertise to teachers in their buildings and across our district. But I do appreciate the commitment of adding that as a budgetary item if needed.
What about technology staff?
I might have to defer to Ms. Duke on this. I'm not sure about the number of technology staff. I know that was her old job. She may have more context than me.
Yeah, I know the director of technology pretty well. He doesn't have enough staff to send his folks into homes to support our families. If that's what you were asking. If you were asking if he has enough staff to man a hotline, you know, maybe during certain times, you know, this is when families can call and allot a chunk of time, then that's probably feasible. You know, it's just how it goes. You concentrate on this, then, you know, something else goes. So just longer response time for staff to repair their computers and things like that.
One of our task members she just sent me a text message. She also mentioned that our student support specialists, they help troubleshoot with computers, as well as our media specialists. And just so I don't forget, Dr. Yeager, she also mentioned that our counselors are designing some of those SEL lessons that we talked about earlier. And then that Coyle Middle School will be piloting the 7 Mindsets SEL curriculum.
Right. We've got, just so I'm clear, we've got support in the buildings on devices and that kind of thing. But it sounded like, Mr. Davis, you were asking about internet connection or support, you know, so if somebody's internet connection is going in and out, their Wi-Fi is not working, that kind of thing. And that's where we, you know, might could offer some telephone support. I hear Taylor walking people through, troubleshooting things off of their, personal connections a lot. So like I said, he could allot somebody to do phone support for certain hours of the day, but going out into their houses, that he just doesn't have enough staff to do that.
Because we had a problem with a board member that needed extra help. And so, you can imagine how parents without all the wherewithal to give assistance would be struggling.
Right.
Dr. Yeager.
I was wondering about the difference between something called MAP and iReady. Is there something we're using already that does what iReady does?
So MAP does one component of that, Dr. Yeager. It does the diagnostic assessment. So we take that 3 times a year and it gives us the student's level.
And so iReady is much different from that. Is that correct?
It's a little more, it's more comprehensive than MAP.
Do we still need MAP or do we get rid of MAP?
We can get rid of MAP. I think one of the concerns is for principals is that we've used MAP for 2 years and they want to be able to see that data around MAP. So we're going to have a conversation at our retreat on Monday about how we balance MAP and how we balance iReady. We don't want them to give MAP if they don't want to give MAP. We don't want them to totally move to iReady if they feel like MAP gives them more information. We're going to give a little autonomy to our principals around MAP and iReady.
Okay, thank you.
Yeah. Okay, I have just one follow-up, and hopefully this isn't repetitive. I heard something mentioned about training. That would be for iReady?
Well, it would be for iReady and some of the other things that we need to do with teachers. Sure.
How much, do you have any ballpark figure on how much that would cost? Because I assume that's not free.
So iReady is in the training, the professional development for iReady is included in the total purchase, as most of our, I think our requests are.
Okay, thank you.
You're welcome.
I have a quick question, Mr. Gaskins. I know you mentioned like earlier when you were talking about the presentation about like increasing the two-way communication.
Yes.
And I know that we used to have like the teachers advisory board, but I know we still have parent advisory board and a variety of different other mechanisms, from LSUTs to the counselor collaborative, which is something I think our counselors still participate in. What do you anticipate? Do you anticipate that two-way communication being with particular groups or with specific people?
I think it would be, without being vague, Dr. Gant, I think it would be with specific groups of people, depending on what it is. So like, for example, when we do our RFPs, or when we did like our RFP for our math adoption, we made sure that we had a diverse group of teachers to give us feedback on that. I would want principals to nominate people as we continue to design our distance and digital learning that are experts in their opinion for digital and distance learning to help us come up with that plan. We just did a homegrown institute training, and we asked principals to send us teachers that were really proficient teachers of writing. So we always try to, I think, qualify and define what that group should look like so we can get good feedback from them. So that would include tapping into our teacher advisory board, our LSGTs. It just, I think, would depend on what we're trying to develop or what we're trying to get feedback on.
Thank you. And my last question has to do with, I think this falls under the reopening plan. I know that initial communication had a 2 weeks, I think it was paid leave 10 weeks unpaid under FMLA. Can you talk some about where that comes from, like where that was pulled from?
I have to defer to Ms. Duke on that one.
So that's federal law. And that lines up with, you know, Mike can help, Mike help me. The 10 weeks unpaid can be paid if they have sick time. You know, I know that's a little consequence when you're faced with potentially missing work for 12 weeks. You know, that's tough. Mike, have I captured that correctly?
You're muted.
Flesh that out a little more. So the FFCRA had two parts: extended sick leave and expansion of FMLA. It didn't add anything to the 12 weeks. What it did was created 2 weeks pay at either full or 2/3 pay for extended sick leave under several circumstances. It also gives 2/3 pay for the other 10 weeks of FMLA, for the only reason being if your child's daycare is closed and you don't have alternative childcare. So it's fairly limited. It's what federal law did.
Right. So that 2/3 pay, you know, somebody pointed out to me that doesn't seem fair, that people that have no daycare available to them because daycares would be closed, which also presumably we would be closed if daycares were closed. But if not the case, they would get paid and not have to use their sick time at 2/3 their pay. And that doesn't seem fair. And I can't really argue that too much. That's just the allowance that the federal government made is to do that 2/3.
Trying to look across my screen to see if I see any other hands or questions. All right, seeing that there are no additional questions, Mr. Gaskins, thank you for that information. I think we definitely look forward to a future meeting so that we can continue talking. Is that the conclusion of that report? Is there any additional information?
No, ma'am, that is the conclusion. Thank you.
Okay, and so there are no other reports that you'll be reporting on tonight?
No, ma'am.
So as we move forward, we are at our item 6.1, our May 2020 financials. Mr. Breyer.
Yes, ma'am. Thank you, Dr. Gant. You have before you the May financials. Again, financials look very good shape. Cash equivalents, investments right around 50 million at the end of May. Should end up the year right around 35 million. And you know, some of that is the Fund 101, which is the property. So really, if you back that out, the general fund portion of that is around 32 million is where we should end up the year, which is what y'all saw in the approved budget back in June. Lisa, if you could scroll down, please. Statement of revenues right on track here. We should end up the year a little bit ahead of budget on our revenues. 89.26% collected as of the end of May. We have some accruals we'll book at the end of the year. We also have our June receipt. So we should end up a little bit over 100% on our revenues. Lisa, if you could scroll down the statement of expenditures. Here you can see we're lagging behind, which would be expected. We're at 77.44% compared to 80% last year. But again, we've basically been out of school with a lot of expenses since, you know, the first part of March. So no great surprise here. Again, keep in mind, I think Mr. Davis asked this question a couple meetings ago. You know, our July and August payrolls, part of that actually goes back to the prior fiscal year. That's why this number is at 77%. it'll end up in the 90% range, but it's going to be, you know, definitely a lot of cost savings there, which we can look at. Lisa, if you get to the very last page, which is the cash flow projection. Again, this thing is somewhat, you know, Larry had this down to a scientific art prior years. Unfortunately, with a pandemic, it's really hard to predict this. You know, Byron and I have spent a lot of time on this trying to get what we think is a good number. Down at the bottom, you'll see the highlighted number is about 4.6 million. We project adding to fund balance. You know, and I did the budget. I think that number is going to be closer to 5, if not over. I use 5 as a conservative number. Again, it's really hard. You know, June is mostly complete, but we really don't. June's our year end, so we really don't complete the June financials to really the end of August, September, because we have some accruals. We have the payrolls I just mentioned. So we really don't have a good picture till September of what the year end is, which is typical. I mean, every school district in the state has that same scenario. So, you know, right now, 4.6 million, I really think we'll end up at 5 at least. That's what we put in the budget. You know, I was trying to be conservative. I could see it going over 5 million as well, which would also be good because remember, we're using roughly 2.6 million to balance the FY21 budget. So, you know, you know, we budgeted based on an 11% reduction. It actually ended up being 10%. So there's a $400,000 difference in revenues to the good for FY21. So that's something to keep in mind. As you go through FY21, you know, if the CARES Act money doesn't help get to the new normal, there is some extra cushion on the revenue side that we didn't discuss when the budget was approved. Because actually, I think that same day, next day is when the state actually found another 1% and was able to give that back to school districts. So there is, you know, a little bit of a cushion in there that can be used for FY21 if needed. So, I mean, financially, the district's in great shape. I mean, our reserves are close to 18%, even with the, you know, going through what we did this year, which puts the district in very good shape for what FY22 may hold. You know, again, austerity will probably be on the table at the state level. So, using that fund balance wisely will be the key for FY22 when the budget's prepared. So I'll be happy to answer any questions y'all might have. But again, everything financially for FY20 looks great.
John has his hand up.
Yes, sir.
Yes, thank you. Thank you, Mr. Griner, and thank you for this great report. So I just wanted to clarify a couple of things. I think I understood it. I just want to say it. So you actually did budget for ultimately for a $5 million surplus this year. So that was already built in. Okay, and so that we're still going to take 2.6 million out of fund balance, although with the 400,000 that the state isn't going to take out after all, it might not be that bad, but no reason to count chickens before they're hatched. So, okay. Let's see. Was there anything else? No, really. You've done a great job here. And of course,
thank you.
Hat tip, as you already said, to Mr. Hamill for that. But I suspect there aren't many districts that are in the shape we're in financially in a good way.
That is a great point. I promise you, the districts I've worked at, you know, I will say even coming from Forsyth, you know, they typically run about a 15%. Of course, you know, the growth there is exponential every year. So it's hard to keep fund balance, but they typically are around 15%. I mean, that's just where they're at.
And just for clarification, that 15% is there as a rainy day fund. So is it correct that most districts, when hit with a great recession or worse, might actually go below that temporarily and then try to come back up?
Yes, sir. That's correct. I actually, Atlanta Public Schools, I was looking at theirs the other day, or I guess when we were going through the budget process, because they were one of the few districts that actually approved their budget in June like we did. I think theirs runs 9 to 10% actually, which is tight. But I think, you know, again, that's just the nature of that district. It's a much larger district. Like the growth factor. Yeah, you're correct. A lot of districts fall below. 15% used to be the state benchmark. Honestly, through all the austerity cuts that happened, you know, from 03 through 17 or so, the state kind of released that 15% and didn't spend as much time on it. So, you know, to y'all's credit, Clark has stayed above that, which is really a kudos to the board over the years of being very conservative and managing that well.
Yeah. So just so I say it for everybody watching, that 15% is there so that you don't hit rock bottom during a catastrophe financially, but we're above 15% in the middle of a really tough time. And we're projected to stay above 15% even through next year.
Yes,
And
sir.
so that's really, really good.
Oh
Okay.
yeah, yeah.
Okay,
And I mean,
good.
you're almost, you're at that 17, or we're at that 17.4%. You throw the 400,000 in there, it gets it closer to 17.8%. So
Okay.
almost at 18%. So it does give a lot of flexibility for FY22 as well.
Okay, that's it. Thank you.
Yes, sir.
Thank you.
Thank you, Mr. Garner.
Thank you, Dr. Gant.
Okay, moving forward with our items.
Dr. Yeager, did you have a question? I'm sorry.
Oh, I'm sorry.
I was just going to reiterate that this training I was at on Tuesday with all the districts around the state, there was a lot of concern about finances. And in fact, lots of districts are having to furlough teachers and furlough staff and reduce the number of days. And we are very fortunate in this district to have the buffer that we have, thanks to the good management.
Yes. And thanks to the taxpayers.
And the taxpayers.
And I have a quick question too, Chris, before we go. Are we going to still go for a zero-based budget next year? We're still balancing. Is that the plan?
Oh yeah, that's the plan every year, Ms. Davis. Unfortunately, we didn't see the pandemic coming. Realistically, we were able to do some stuff for our employees this year with the step increase, the custodial compensations, the custodial increase from the compensation study at our pre-K teachers. If you take those three items out, actually, which I would not suggest we do, I'm glad we were able to do those, but we would have actually had a pretty much balanced budget this year. So, but we were able to give that, maintain the fund balance at a high level, and also do that for our employees, which I think is.
That sounds great. So if we know that we're on that trajectory for next year, we can probably take care of that last group that we didn't address this year, Ms. Duke.
Yeah, it all depends. The
Yes,
biggest
ma'am.
thing for FY22 is what that austerity number looks like. If the
Right.
state keeps the 10%, it's going to be hard to have a balanced budget because the CARES Act money is probably a one-time. It probably won't be there next year either. And if the state comes back down to the 5-6% range, then yeah, a balanced budget is definitely doable even without the CARES Act money. So.
Okay. Or we'll be tightening up some things, especially. I'm curious about how since most of our budget is in salary anyway, having our teachers do virtual isn't gonna impact that bottom line at all. It's just the salaries are gonna stay there because we have the people.
Yeah, the only thing that, might be a savings, but honestly, you just don't know because of the, people being out. I would say our sub budget might be a little bit less, but I think you can't really count on that either. So,
okay.
Yeah.
Well, I feel good that we're healthy, and that's important. Thank you.
Yes, ma'am. Thank you.
But at the same time, I like the fund balance, but when we start looking at expanding the nursing staff or the technology staff, let's don't pinch penny and cost our students the quality education that they deserve. So, I think it's great to be ahead, but it's there for a reason as well. So I just throw that in there.
Yes, sir. It's a good point, Mr. Davis.
Thank you. Any other comments or hands that I don't see? Thank you. Thank you, Mr. Greiner. We'll move forward. Item number 6, and with policy. And these are all policies that are to be posted for public comment. Dr. Yeager, I'm going to turn this whole section over to you.
Okay, thank you, Dr. Gant. So again, the philosophy of the policy committee is to spend the next 6 months focused on responding to the Cognea directives. And so we are focused on B policies that they called out that we need to make sure are precise and working, and also old out-of-date policies that have not been reviewed in 5 years or more. And so this week we have 7 policies to move through to put up for public comment. I'm sorry we didn't have a work session so we could talk through these more directly. There were a few questions that I think I addressed from John earlier today. I'll run through them pretty quickly. 7.1 is policy BH, which is our, excuse me, let me get the name correct, is our board ethics. And this revision that we've added is simply to bring the policy up to consistent with state statute. The wording of the number 7 and number 8 of domain 5 at board meetings was not consistent with statute. So we've just modified it to totally match statute. Now, Dr. Knox requested that we add 2 words. So we are allowed to add 2 words to what is statute. We can't take away, but we can add. And so he has recommended the change, which, thank you, Angela, is up there now. So we've modified 7 to now be to allow free speech basically by board members. And then number 8 is what used to be number 7, which is that we abide and support all decisions of the board. So if I could get a motion or any questions or comments about this revision.
Can we go through all of these and, you know, if there is one that we have to vote on separately, do that?
So
you want me to do them individually?
Do you want me to push them all forward as one motion? That would be fine. I can just
I would
go
love
through
that. It's 11 o'clock.
Okay.
But tell us about them. I think that would be good.
You want me to describe? So if there were any questions about BH or you're happy with them, I will carry on to 7.2, which is GBP, a professional personnel reemployment. This is just a review. The policy is consistent with current practice. And so there is no revision. It's just that we take a look at it and review it. And it's no changes. 7.3 is GBRA. This one was a little bit interesting, especially we did get some comments from the public on this. We are rescinding this policy because for 2 reasons. One is that it is out of date. The use of the word fitness, and Lynn, please jump in here if you want to jump in here. But fitness for duty is not a phrase we use anymore in HR. And so it is out of date in that regard. This policy is from 2007. The other thing is that it's redundant with the FMLA and ADA actions. So I know it feels a little bit odd that we're taking this out, but the policy is in other places. The FMLA policy, oh shoot, I wrote down the number, but I've lost it. I'll make sure I have it ready for the next meeting. So that one is
FMLA and ADA, was it not?
Yes, ma'am, FMLA and
Thank you.
ADA. Okay, 7.4 is a rescinding of the professional retirement. So this is a really old policy that talks about all employees are required to become members of the retirement system. Again, this is no longer how we practice the retirement. Most of the retirement information is provided to our staff through a HR manual or a handbook, I believe, instead of a policy. Again, any questions, please interrupt me. 7.4, no, sorry, yeah, 7.5, excuse me. Professional workloads, this one was totally fine, is what I understand. It's consistent with current policy. It just needs to be looked over and not revised at all. 7.6 has to do with, again, just reviewing, looking it over. It's consistent with current practice, duty-free lunch periods for personnel. There was some discussion about how COVID might impact our practice of this policy, but I believe that the workarounds and the exceptions due to COVID are part of the discussion. Lynn, did you want to touch on that a little bit? No, okay. It was fine as is what I understood. Okay, and then finally 7.7. This was a updating of our dress code policy for staff. We had a long, interesting discussion of, first of all, we can't discriminate dress code based on the long categories of reasons we don't discriminate against people anymore. And then we also removed some code words. You know, we're all becoming much more sensitive to these code words that people use when they really mean something else. So we removed things like decorum and decency and good taste to say instead professional. And I thank Ms. Davis for making us even more sensitive to that topic. I feel much better about this dress code policy. So those are the 7 policies to be put up for public comment. So any questions? I saw John and Greg.
Well, I'll defer to Greg because I was just going to make a motion. And
Okay.
Greg, what were you going to do?
I was going to try to stop your motion. I am not comfortable with what has been proposed as an addition to policy BH. I think it's like what the Lord giveth, the Lord taketh away. I mean, I think, you know, that when it says that members of such board from discussing freely discussing the policies and actions of such board outside of a board meeting. I'm not reading the whole thing. So actions of the board outside of board meetings. What John's getting at, what I would suggest that we do it in terms of norms, is I think what you're getting at, John, is how are those, how do board members, once the decision is made by the board, how is it adopted? I mean, yeah, there's some noise background someplace.
Yes, there is.
Oh, sorry.
Okay.
So I'm sorry, Greg, are you unhappy with 7 or are you unhappy with 8?
I'm unhappy with what was added since the policy meeting.
Okay.
Okay,
That would be 8.
That was number 8. All he said was he added the words "and support" to abide by. That's the only thing John added. I don't know if that's clear to you, but so we added, so the policy, the statute, so the statute as written is 7. The addition to 7 is the statute as written. The addition to 8 is the statute as written plus the word support.
And support.
And support.
Okay, I guess I don't understand why we're adding it.
Adding what? And support?
Yeah.
Okay.
Yeah, may I speak to that? Since it was my bright idea. The reason I suggested adding that is, well, first of all, we have had abide by and support in our ethics policy for as long as I know of. So it's actually no change from where we've been. I suggested it because I think if you remove the words "and support," then it becomes a little mushy. You abide by the board's decision. Well, what does that mean, really? We can get into semantics. I just thought that "and support" made it clear that even if you're on the losing end of a vote, which I have been many times, you still support the overall decision. Abide by kind of makes it like, it sounds to me, and that's just me, it sounds like you're kind of sitting there, but you're kind of grumbling about it. My interpretation of how we're supposed to function as members of a school board is that we can fight like dogs and cats, hopefully not, before a decision, but then once a decision is made, you can say, and that's part of what the addition is, it's even more explicit. You can comment about your vote, but the group decision, the majority decision, you support. So that was why "and support."
Is that not already stated somewhere in our, is that in our ethics or something?
Well,
seems
it
to me
was.
like-
So,
It was.
yeah, it was in 7. So before the state statute requirement change, we had in 7 express opinions before votes are cast, but after the board vote, abide by and support all majority decisions of the board. So that is our existing policy. And now to match statute, we have to add this part about free speech. And the statute for some reason did not have the word support in it. It just said abide by all decisions.
I think it's because the support word would interfere with your free speech, would it not?
Yes, thank you, Linda. That's what I'm getting at.
Okay. Well, we
Okay,
can
well-
move this forward and think about it and decide to change it a month from now after public comment. So public comment would allow us to also think about this a little bit.
Okay,
That
I
would be
just want to
great.
now just a little bit more since I'm the one objecting. Is that abide by means that you are simply going to follow it. If the board passes an act or an action that says for 1 minute, if you're late for every minute that you're late to a meeting, you're docked $1. I will, certainly board members will have to abide by that. But there's a difference between, I may not support it, and I may go out and I may go to the public and say, it's not right for a board member to be docked $1 for every minute that they're late to a board meeting. And so I see a difference. So anyway, I will refer to what Patricia's saying, but.
So if I may suggest that we remove it for now, and when that we talk about it in terms of our norms, and see if we can accommodate this behavior within norms. And if not, we can add it back in a month, or we can also ask for public comment on this topic.
Yes.
Yeah, well, and because it's going to be posted for public comment, it still gives us the room to go back to policy, right?
Yeah.
And be able to talk about it. So I don't
Exactly.
know that we have to remove it. It doesn't prevent us from talking about it and making changes. I don't think.
Okay, great.
The addition was made after policy. That's the
Yes.
problem. That addition was made outside of the policy meeting, so it shouldn't be there unless we've agreed that it should be there.
And so, Dr. Yeager, are you saying you'll take out those 2 words, or you'll take out this
I'm
whole?
okay taking out the 2 words for now.
That's fine. I just want to add that the reason I had suggested that in the email that I sent to all board members this afternoon was that specifically thinking about Cognea. It's an important part, I think, of our proving to accreditation officials that we have guardrails that we're putting into place so that we don't have a situation again where we have a vote that is essentially not supported by board members and then overturned. I think that's my intent. I want Cognea to understand we're making progress. Thank you.
Doesn't change that behavior though.
I think I see Mr. Worthy's hand.
Yes, I just want to make a quick comment. Just a reminder from our training on Tuesday night, when we use acronyms, we need to spell them out. I've heard FMLA all night, which is Family Medical Leave Act. We got to get in the habit of doing that, especially for our audience, because of the fact they don't know these things. I just want to make that comment. We had a training on that. There's a number of things that we said we're going to do, and we need to do them.
Thank you for that reminder, and thank you, Mr. Davis, for sharing those concerns. And so it looks like we are ready for a motion with those 2 words taken out. I think that was the original.
Yeah, I just sent Ms. Tillman a note, but I don't know if I can't see the version that is up, but I expect, yeah.
For the record,
I propose that we send them out for these 7 policies that we move to send them out for public comment.
Second.
Okay, so we have a motion by Mr. Davis, a second by Mr. Worthy. There's not any additional comments, are there?
No.
All in favor?
Aye.
Okay. Mr. Gaskins, just.
Aye.
Okay. Mr. Gaston, just for the record, can you take roll call for this?
Yes, ma'am. Mr. Davis,
Aye.
Mr. Stevens,
Aye.
Ms. Davis,
Aye.
Dr. Yeager,
Yes, aye.
Dr. Dykeman,
Yes.
Mr. Worthy,
Yay.
Dr. Gant,
Yes.
Dr. Knox,
Yes.
Dr. Maddox.
Yes.
Thank you. So that motion carries. Those 7 policies will be put up for public review. Moving
Thank
forward
you.
to number 8, Dr. Yeager.
Okay, so for number 8, we had 15 policies that went up for public comment. I received the public comment this afternoon. So the first 5, there were no comments. 8.1, 8.2, 8.3, 8.4, and 8.5, there were no comments. There was one comment about 8.7, but it seemed to be a misinterpretation of the editing that we were doing. The person commented on gray words and thinking that those were being removed. And I think it must be the way her view of the yellow looked gray. So because the way she described it. So I don't think that comment was actually a concern about the policy. So 1 through 7, I think are fine without public significant public comment. 8.8, which was our revision of the EOE, the Equal Opportunity Employment Act. There was a comment that we should add a provision for hiring initially at appropriate professional and pay levels. So one of the things about equal opportunity employment is that women, for example, tend to negotiate lower salaries for themselves because they're not trained to be as fierce of a negotiator, or the same with people of color, that they don't have the same incoming salaries, and that does sort of set you up down the road for lower income through your life. So I thought that was a reasonable noting. And so I would recommend that we send 8.8 back to the policy committee, because I looked around in our policies and this afternoon since we got this comment, and I can't really find anywhere. Maybe Mr. Pruitt, if he's still on board, could comment if we do have such a policy about equal incoming salaries for gender and some of the other things we talk about in the equal opportunity category. So I'm willing to send 8.8 back to policy to work on. But 1 through 7 are fine. 9 and 10, there were no comments. 8.11, the comment had to do, oh, this was John's comment, whether we wanted to really remove the retaliation clause. This was a simplification of the communication between board members and the community, and we had removed the retaliation clause because it seemed out of place, and there's other places in the policy that have retaliation. So John, I'm willing to take this one back and discuss if you want me to, and think about where we have anti-retaliation policies across the board.
Yes.
What was that again? I'm sorry.
Sorry, 8.11. It's the GAM, staff rights and responsibilities, which is oddly named. We actually changed the name of it to communications with board members, staff communication with board members. So we kind of, this was a very broad, old policy that we tried to narrow to the single discussion of how board members are allowed to talk to community members. And that's why we removed the retaliation piece. But if you're concerned about it, we can discuss it a little further.
Should I speak to that now?
Please.
Just, okay, very quickly. Yeah, I want this is the part that says, and I was looking for it and I knew I'd seen it, and then I remembered where it was when I reviewed these, that board members don't go and seek out staff to talk to, but it's not the same way the other way around. Anyone that's a staff person can talk to board members.
Right.
And so that's an important thing to point out. What I said in my email is that I don't think that for my entire term on the board so far that CCSD staff have felt comfortable doing that. And so I just thought it would be important to, number one, make sure everybody understands that this is where that is, policy GAM, and furthermore, that retaliation is forbidden. And so that should, in principle, give staff the ability to feel like they can actually speak to board members without threat of some kind of professional retaliation. And that's built into our policies. So if we could just kind of say that, I'm not saying add anything other than just the text that says, oh, and as per policy XYZ, wherever it is, no retaliation will be taken against anyone that does this. That's it.
Is that a federal law about retaliation?
So we have a lot of words about retaliation in our discrimination and harassment policies, GAE, GAEA, GAEB. So it's in there, but I do agree that that maybe doesn't cover necessarily a condition or a policy that doesn't have to do with harassment or discrimination. So,
because it's a federal law, is it not?
Yeah, I mean.
Yeah, there's several types of retaliation that are that's prohibited for exercise of rights, and one of those is your First Amendment rights. So you can't retaliate against an employee for exercising their First Amendment rights. But remember, an employee's First Amendment rights are limited to speaking on matters of public concern as opposed to matters pertaining to their own terms and conditions of employment. So it gets complicated.
So,
Well,
Mr. Pruitt, would you recommend we take this back to policy to address?
As a member of the policy committee, I agree with John totally. I don't know, I must have had a brain aneurysm or something. So I think that sentence should have not been taken out. So I would like to see it back in policy.
Okay.
Okay, so let's
take it back to committee.
Yeah, so we're taking 8.8 and 8.11.
8.11. Mhm. And what we can do once you're done, Dr. Yeager, is like, as we vote on these, sort of like take the sections. Yeah, I don't know if you have the notes too, but like 1.7, 8.8. Yep. Okay, continue.
Okay, and then 8.12 was no comments. 8.13 was no comments. 8.14, there was one comment about, so this 8.14 is the professional personnel recruitment, where we it talks about all kinds of recruitment, but is where we have put our minority teacher recruitment plan. And we changed some of the wording to focus on recruiting at historically Black and other minority serving institutions. And the comment, excuse me, was, why do we not also include all colleges recruiting minority people from all colleges? That why would we just focus on minority serving institutions? Which is a legitimate comment, I think.
So we do go to non-minority colleges. If you want to add that in there, that's fine.
Okay, so we could kick
it's not anything we're not doing.
Yeah, it seems like it was something we're doing. We just didn't emphasize it in this particular policy. So I'm willing to kick that one back to policy as well. So there's 3 that we would kick back to policy. There were no comments on 15. So I would suggest we have a motion for 1 through 7 to pass or do what it says it's going to do, rescind, revise, or review.
I so move.
Thank you, Linda. Second.
Second.
Dr. Gann, you should do the vote.
Well, and we've already discussed, but just for the record, are there any hands and further questions?
Yep.
Okay.
I just wanted to clarify the motion. Exactly which ones were they? Because I didn't.
Do we want to do all of them?
That was the
forward?
question.
Okay, so
yes.
1, 2, 3, 4, 5, 6, 7, 9, 10, 12, 13, and 15.
Good. Thank you.
And to be clear, that motion is to take the action that's listed outside of those that Dr. Yeager just listed.
Right. Revise, review, or rescind as described.
As listed. Mm-hmm.
Okay.
So who made that motion? Was that
Linda.
Ms. Davis? Okay. And then there was a second with who?
Mr. Davis, I think.
Mr. Davis, and then Dr. Knox's questions. Any other questions? Okay. All in favor, Dr. Mr. Gaskins, if you can take a roll call for us.
Yes, ma'am. Mr. Davis,
Aye.
Mr. Stevens,
Yes.
Ms. Davis,
Yes.
Dr. Yeager,
Yes.
Dr. Dykeman,
Yes.
Mr. Worthy,
Yes.
Dr. Gant,
Yes.
Dr. Knox,
Yes.
Dr. Maddox.
Yes.
Thank you very much. So that motion carried for 1 through 7, 9, 10, 8, 1 through 7, 9, 9, 10, 8, 12, 8, 13, and 8, 15 to be either revised, rescinded, or reviewed as indicated on our agenda. Thank you, Dr. Yeager.
So then we need another motion to send 8.8, 8.11, and 8.14 back to committee.
So moved.
Second.
Any additional questions? All right, Mr. Gaskins, if you would do a roll call for us.
Mr. Davis,
Aye.
Mr. Stevens,
Yes.
Ms. Davis,
Yes.
Dr. Yeager,
Yes.
Dr. Dykeman,
Yes.
Mr. Worthy,
Yes.
Dr. Gant,
Yes.
Dr. Knox,
Yes.
Dr. Maddox.
Yes.
Okay, thank you. So that motion carried 8.8, 8.11, and 8.14 will be sent back to policy. Thank you. All right. See if I can find my place here. Personnel recommendations. Mr.
Dr. Gant, I recommend the approval of the personnel list as presented.
So moved.
Second.
Okay, Mr. Davis, and I think that was Mr. Worthy. Any questions or discussion?
I have
go
just
ahead.
one. I have just one quick question. So there aren't any addenda to this, and so anything that's not on here would come up like next month. Is that right?
I believe that is correct. Is that correct, Lynn?
We're just getting as many people as we can. So every time we have a meeting, we're throwing,
Sure.
it's been added since the last time we had a called meeting, I think was our last meeting.
Okay. Well,
We
thank
added, this was through,
Yeah.
I think Friday.
Through Friday. Okay. Well, that explains it. Thank you.
Any additional questions? All right. If we'll take a vote for all in favor, Mr. Gaskins, if you would conduct roll call for us.
Mr. Davis,
Aye.
Mr. Stevens,
Yes.
Ms. Davis,
Yes.
Dr. Yeager,
Yes.
Dr. Dykeman,
Yes.
Mr. Worthy,
Yes.
Dr. Gant,
Yes.
Dr. Knox,
Yes.
Dr. Maddox.
Yes.
Okay. Thank you. So those personnel recommendations have been approved. Item number 10, if you took a look, I think there were a couple of questions I think I've seen from Dr. Knox, but if you take a look at 10.1 through 10.4, all of those are board meeting, actually 10.5.
That's correct.
All board meeting minutes. And so I do want to encourage us to, when there is a motion, we may be able to combine all of those, but were there any additional thoughts around those before we?
10.1 through 10.3 are fine. I would like to talk about 10.4 very briefly.
Yeah.
So if I'll open the floor for a motion for those, to accept those meeting notes for 10.1, 10.2, and 10.3.
So moved.
Okay.
Second.
Mr. Davis and Dr. Maddox. Okay, Mr. Gask. Oh, any questions? I don't think there are any, but just for the record. Okay, Mr. Gaskins, if you would conduct a roll call for us.
Yes, ma'am. Mr. Davis,
Yes.
Mr. Stevens,
Yes.
Ms. Davis,
Yes.
Dr. Yeager,
Yes.
Dr. Dykeman,
Yes.
Mr. Worthy,
Yes.
Dr. Gant,
Yes.
Dr. Knox,
Yes.
Dr. Maddox.
Yes.
Okay. Wonderful. That those meeting notes have been approved. Item 10.4, and this is from the call board meeting on June 25th. Dr. Knox, I think you had a.
Yes, I guess the best way to do this is just for me to go ahead and say, should I motion to amend? How about that? And give you the amendment. You tell me.
What you can do, Dr. Knox, is state in your motion to approve the minutes with the
There we go.
following amendment.
Thank you. Thank you. I knew there was a way to do it. So I move to approve the June 25, 2020 minutes with the following amendment. Under point 3, consideration of real estate, I respectfully request that the sentence be amended to read, John Knox shared that he is in full support of the, and here's the change, lease purchase agreement, comma, noting that this agreement gives the district nearly twice the space at $1 million less cost through year 1 versus the previous option presented to the board last fall. There. That is the motion.
Would you mind sending that to me?
I am
please?
sending it to you right now.
Thank you.
I second that.
Any follow-up questions or discussion?
Yes, why is it necessary to refer to something that's not in evidence in this meeting and in this transaction?
Because I said it, and it's part of what was said at the meeting.
So again, I'm just trying to understand why are we talking about a transaction that didn't happen in this transaction?
Because the minutes accurately reflect what was said at a meeting, and I said it.
But we don't do verbatims on everybody, on everybody's comment, right?
Right. I am asking that you do it here.
I think if you wanted to do that, Linda, it would be done.
Well, I'm just curious as to why we're doing that, though. I mean, I don't understand.
Do we have a second?
Yes.
And we're in the
Okay.
question period. Yeah.
Any additional questions, concerns, or comments? Okay, Mr. Gaskins?
Mr. Davis,
Yes.
Mr. Stevens,
Yes.
Ms. Davis,
No.
Dr. Yeager,
Yes.
Dr. Dykeman,
Yes.
Mr. Worthy,
Yes.
Dr. Gant,
Yes.
Dr. Knox,
Yes.
Dr. Maddox.
Yes.
Okay. Thank you. Hold on, let me pull up a different screen here. We are
10.5.
at 10.4, right?
10 point.
No.
Five.
Did we just
we just
did we
passed
just do
10.4.
10.4? Okay.
Yeah,
10.5. I'll open the floor for a motion to approve
moved.
minutes.
Second.
Okay, that was at Mr. Davis and Dr. Yeager.
I think Mr. Stevens got me first.
Okay, Mr. Stevens. All right, any follow-up questions around this or discussion? Mr. Gaskins?
Mr. Davis,
Yes.
Mr. Stevens,
Yes.
Ms. Davis,
Yes.
Dr. Yeager,
Yes.
Dr. Dykeman,
Yes.
Mr. Worthy,
Yes.
Dr. Gant,
Yes.
Dr. Knox,
Yes.
Dr. Maddox.
Yes.
Great, thank you. All right, moving forward to item 10.6, this action to approve the purchase of iPad digital learning devices for student use.
Can I move that we talk about or do 10.6 and 10.7 together?
I agree.
Sure.
I agree too, totally.
Okay, so we have,
Actually, and 10.8
Well-
too, 10.8.
Yeah, I read those
All three.
thoroughly.
okay, hold on one second. Let me just be 10.5, 10.6, and 10.8. Okay, is there a motion on the table? Was that a motion, Dr.?
Yeah, I move that we approve 10.6, 10.7, and 10.8.
I second it.
10.6, okay, I have it, 10.7 and 10.8, okay, and that was a second by Mr. Davis. Any follow-up questions or discussion?
I have a question about one of them, but hold on, I have to find it.
Okay.
So, okay, 10.5, 10.6. 10.7, my question was, this is the action to approve student device purchase for grades K through 2. Is this a replacement for things that we already have, or is this new purchases?
This would be new purchases. We currently have one-to-one devices for our 3rd through 12th grade students. We would expand our one-to-one to kindergarten, 1st and 2nd grade.
Okay. And this is with the anticipation that there would be potential digital learning for these?
Yes, yes, ma'am.
Every Friday.
And then, so that was one question. And 10.6, I think John had asked this question. There aren't any amounts or numbers on 10.6. Or is that just to be able to use them at all?
So the purpose of there not being specific numbers is because for each specific grant, there's a separate accounting. And so this will also allow us to have digital devices for our pre-K students to be able to utilize for distance learning and for access to online books through the MyOn to support their distance learning.
So all we're approving here on this one is just the use of them, or
the purchase.
Purchase.
I guess it's just different because usually we have an amount that we're purchasing and how much it will cost, and this doesn't have that.
Does this come out of general fund? It comes out of your
No,
break from
ma'am,
the start,
it's
right?
going to come out of our, it will come out of our GOSA grant, our Right from the Start grant,
That's what
our
I thought.
Head Start grant, and an early Head Start grant. And each of those numbers would be tied to the numbers of students in the
Correct.
individual programs.
Okay.
That's what I thought. Thank you.
Okay.
And those we can get them at a reduced price by being able to purchase them. So they're just under $300 per unit.
Great.
Thanks, Karen.
Oh, sure. No problem.
Additional questions? All right. Well, so we have a motion for 10.6, 10.7, and I think it was 10.9. Or is it 10 point? Oh, whoops.
No.
No.
Eight is the grant.
10, 7, and 8.
7 and 8.
7 and 8.
6, 7,
About
and 8.
6.
Yeah.
6.
Okay, 6, 7, and 8. I'm sorry. So we have a motion on the floor for 10.6, 0.7, and 0.8. Mr. Gaskins, if you could take our roll for us.
Yes, ma'am. Mr. Davis,
Yes.
Mr. Stevens,
Yes.
Ms. Davis,
Yes.
Dr. Yeager,
Yes.
Dr. Dykeman,
Yes.
Mr. Worthy,
Yes.
Dr. Gant,
Yes.
Dr. Knox,
Yes.
Dr. Maddox.
Yes.
Okay, thank you. All right, item 10.9. The floor is open.
I move that we approve the CDW technology purchase for Athens Christian.
Cares.
CARES, it's CARES Act, ESSER, and I don't really know which one that acronym stands for. But
I
it's dealing
second
with
that.
thank you.
So there was a motion by Ms. Davis and Mr. Worthy. Questions and discussion. I know there was one.
There was one in the email that I'm not sure I
Mm-hmm.
saw the answer for. I know there's been some discussion about the pass through for the CARES Act.
There was an answer that was supplied to, I believe.
Right.
I know Mr. Stevens and maybe Dr. Knox had questions about this.
And we have
Right, I
Hope
know
McGuire, our director of Title I. She's on our Zoom just to answer any questions that you have.
Good.
Just for the public's sake, because there has been quite a bit of discussion about this for transparency, could you share why we are giving money to Athens Christian School? I know you've shared it with us, but I think it'd be it'd be good to let the public know.
Yes.
No problem at all, Dr. Maddox. First of all, we are not giving money to them. What is happening is that we are being used as a conduit for the federal government by way of Godot to ensure that private schools are receiving funding through the CARES Act. And ESSER is elementary, secondary, emergency relief funds is what it's for because of COVID-19. So as my director of Title I presently work with 2 private schools with equitable services. So they use us as the Title I director to continue that work through CARES Act. And so one of the things that I'm doing now is working with 6 private schools who are all in the Clark County LEA boundaries to ensure that they are getting their CARES Act allocations. And then we are the conduit to make sure that they're using their funds on what they said that they were going to use their funds on. So I've had to have consultation meetings with the entire group. Then I had to have individual consultation meetings that will continue as we use CARES. And those funds will actually be earmarked. I can send you guys the updated sheet that I have where I've already met with everybody twice. And we've already detailed out how they're going to spend their funds. The one thing to remember for the technology purchases is that these are to 2022, and then they are technically possessions of Clark County School District. So at the end of CARES Act, we receive those back. And I think I put that in that box with a link to let you guys see the verbiage that comes directly from Godot.
Thank you, 'cause I truly didn't understand it like that. I appreciate that.
So I have one question that came to mind. So do we get an administrative fee for that, for managing that for the private schools?
Yes, ma'am. I went with the, I worked with Chris, and we did 10% of the allocation, which was the highest that we could go for the administration fee.
Thank
and
you,
all
Ms.
of the private
McGuire.
schools are in agreement. You're welcome.
Great. That's awesome.
Question. What happens if the suit that's being filed against the U.S. Department of Education about this money going to private schools? If they win their lawsuit, do we get our money back?
Well, actually, we're lucky in Georgia. We're already going to be getting our money back. So Superintendent Richard Wood already has it on a recommendation to the State Board of Education on July 23rd for us to receive our allocation, an additional allocation to cover what we had to cover for private schools.
So that means every dollar that was designated to Clark County for the CARES Act will be we will be allotted, is what you're saying.
So the private school equitable share portion, yes. So that's the $501,000 roughly is what we'll be looking at receiving back.
So technically, I guess if the lawsuit that a lot of states have filed against the U.S. Department of Education wins, then the money will go to the Georgia Department of Education, because we would already have.
Our superintendent is actually just expecting us to keep it the way it is. So lucky for us in the state of Georgia.
Yeah, Mr. Davis, I'll jump in there real quick and correct me if I'm wrong on this. I think what Georgia was doing, they had a contingency fund. When they got the money from U.S. Department of Education, they weren't spending or allocating all that money to the school district. They were actually holding back like a contingency fund for maybe a second wave or whatever. So what they're doing is pulling that money out of the contingency fund. So I think if the lawsuit, went in that favor, Godot would put that money back into the contingency fund to eventually distribute it to the school district. And they were maintaining a very small administrative fee at the Georgia Department of Education. I think it was less than 1% or right around 1% of the money. So they're basically pulling from that contingency fund to give that money to cover the private school portion. So yeah, if the lawsuit settled out, in their favor, then that money would just go back in that contingency fund. So.
And we also didn't have as many private schools participate as they thought for the state of Georgia. Dr. Maddox,
Thank you,
you
Mr.
had your hand up.
Oh, sorry. Somebody else had their hands up?
I believe Dr. Maddox had her hand up, but
I was clapping. It's late. I'm just trying to do whatever over here.
Does Mr. Stevens have a question? Yeah, Mr. Stevens.
Yes. Similar to what I already pointed out to in my email there, this just didn't sit well with me that public schools are even involved with this. And it had Betsy DeVos's name wrote all over it. So I'm a no vote on this. I'm very uncomfortable that public schools are involved in giving schools with over $8,000 tuitions any type of funds. And it just needs to be ended. So.
Thank you, Mr. Stevens, for sharing your concerns. Any additional concerns or questions? I'm looking across pictures, but you have to help me out. My eyes are a little bit hazy right now. Okay. Mr. Gaskins, can you do a roll call for us?
Yes, ma'am.
Item 10-9. Thank you.
Mr. Davis?
Yes.
Mr. Stevens?
No.
Ms. Davis?
Yes.
Dr. Yeager?
Yes.
Dr. Dykeman?
Yes.
Mr. Worthy?
Yes.
Dr. Gant?
Yes.
Dr. Knox?
Yes.
Dr. Maddox?
Yes.
Okay. Thank you very much. That motion passes. I think it was 8-1.
Yes.
Okay. Moving forward to item 10-10, to approve the curriculum associates already.
So moved.
Second.
Okay. I'm going to open up the floor for discussion. I know some of this was ran into the earlier discussion.
So what I heard Mr. Gaskin say is that this is not just the same as the MAP assessments. It's something that's much bigger and much larger, and it's going to help us deal with the, what did you call it?
Unfinished learning.
Unfinished learning. Thank you. And I got the sense for me that it's pretty critical for that piece of the puzzle. Is that correct?
That is correct.
So I'll be voting yes.
Yeah, the one question I had, Mr. Gaskins, I don't know if you had a chance to answer it today, but in our exchange of emails, but I understand the assessment piece. God, I think I've forgotten, but it's the personalized learning piece. Now, what does that look like? And I understand the toolbox stuff, but what's the personalized learning piece of it again?
So the personalized learning is based on the initial diagnostic assessment that students receive. And so it gives them a grade equivalent level. And it also lets a teacher know what skills they are weak in as it relates to that level. And then it personalizes lessons for that student to take that are interactive through the platform.
So the assessment, so they actually are able to, the software actually goes and teaches or introduces the student to material that they missed on the assessment? Is that?
Yes, that's a pretty good way to describe it, Mr. Davis. And then it gives them practice activities and problems. And as students master those skills, then it progresses to more difficult activities for the student.
Is this always sold as a packet? I mean, is this typical that school districts buy the whole kit and caboodle?
We elected to add the teacher toolkit because we realized that it offered some additional lessons for teachers that were not digital. And we thought that that was important, that if a teacher wanted to do a small group activity with manipulatives that was one-on-one or in a small group, that would be important for students.
Okay, thank you.
Yes, I just wanted clarification. How is the software that we're talking about? I have a little bit of a hard time visualizing. I tried to go through the PDF, but it's like 612 pages. Could you just tell me, since I'm a college teacher, I use what's known as a learning management system. At UGA, it's called ELC. How is this similar or different from a learning management system?
So it is not a learning management system. So the difference or what a learning management system has that iReady does not have is it doesn't have a grade book. It doesn't have an opportunity for teachers to add additional assignments through, they can assign lessons, but not additional assignments outside of the iReady platform. I think those are the biggest differences. And then it will work with our Clever system, which is single sign-on, but a learning management system like Schoology or even what we use with Google Classroom, you can integrate multiple platforms into a learning management system.
Okay, so for like students who are really behind, would this be better than what we're going to vote on in a second? Would that be better than a learning management system? And if so, how?
So yes, it will be better than a learning management system because a learning management system doesn't provide the content. The learning management system organizes the content. So in a learning management system, you may have multiple platforms that gives ease of use to students. So instead of students logging on to separate things, they go to the learning management system where all of those things are available.
Okay, all right. So what the real benefit here of iReady versus a learning management system is that the content is built in, and so that saves you. For example, if you're in a situation where you don't have any content experts, you just have a kind of a plug and play thing. It's just all built in. Is that right?
That's correct. And I think the other thing, and I don't want to just focus on remediation, but also it provides acceleration for students. And sometimes teachers find difficulty finding the right rigor of assignments for a student that is working maybe ahead of other students. So it also provides that remediation as well as acceleration for students.
Oh, okay. All right, so yeah, it just gives us an advantage because we don't have to worry about developing the content. iReady is iReady. It's ready and it's got all the content, and so we don't have to ask anybody to do anything.
And we've had a system similar to this, Mr. Gaskins. I can't remember what it was, but I know we had one with reading where after kids mastered a certain level, then the assessment sent them to a different place. I can't remember what that was, but this, and it was probably in middle schools or elementary schools at one point. And a similar thing for math, because the kids were able to earn things like a computer or a notepad for completing certain courses in here. But the fact that this has been in trial at Alps and Gaines is very encouraging to me. So, and we're seeing some changes there, so I'm grateful.
Mr. Gaskins, so with iReady, I know you mentioned that it would be used for people that have, or this, our students that have, I can't even remember the term anymore, unfinished learning. Like for this cost, does it provide access for all students, or has the district said based on previous performance or some other universal screeners, like we're purchasing access to this for 10% of our students or 50% of our students?
It provides access for all students. Something that I did not mention earlier today is also a universal screener for our high school students as well. So it doesn't provide the personalized learning for high school students, but it does provide the universal screener for high school students. But what we have purchased is an unlimited license for every student, and it's appropriate for every student, either for remediation as needed or for acceleration.
Okay. And then what happens to those universal screeners? I think I remember someone asking something similar, but I just can't remember the answer. The universal screeners that were used before, or are we talking about sort of two different issues or areas that we're assessing with the universal screeners?
So we've had some issues or some feedback around changing our universal screener for high school. So this would replace the universal screener for high school. We are meeting with principals on Monday to discuss MAP, which is a universal screener, and iReady, that is a universal screener. We want to give some schools autonomy around moving totally to iReady or using them in a hybrid model. We have received a significant discount with MAP. We informed them that we would not be using it potentially at the same level. So schools will still have the option of using iReady, using MAP, or creating some hybrid model to use both.
Okay, thank you.
I had a question also, if no one else does. So iReady is something that has a lot of content in it already. And so a teacher could, they do the diagnostic or the assessment or whatever, and then it prescribes particular things that the student needs to know. And the teacher could assign things within iReady, right? Is that the way it works?
Yes.
And then is the teacher also able to assign other things? Like, do they have to use iReady, or is iReady there as something supplemental?
iReady is supplemental. So it is for, and what we will present is for remediation and for acceleration. Our on grade level content will be with the math adoption materials that we just adopted, so they can assign them activities from Eureka or Kendall Hunt, or from our Fontes and Pinnell, or from our Lucy Calkins units of reading.
Okay, so they'll be using the same curriculum for the digital students as the in-person students.
Yes, yes.
But they can assign other things that students can do on their own through iReady.
Exactly. What I've seen about iReady is that teachers usually use it as a station. So when they are working with other students in a teacher station, they might assign iReady as an independent station. They've also given it for homework. Sometimes they replace it as a bell ringer. So instead of students coming in and doing morning work, they might get on an iReady lesson that is personalized for their level.
Okay.
Other questions, Dr. Knox?
Yeah, yes. So I needed to ask some questions so I could kind of make my own determination. And we're encouraged to do that. Our board training just the other day encouraged us to say why we vote, how we vote. And so I'm going to be voting against this, and I want to be very clear about the reason why. I feel like the price tag is very high. It might be 3, 4, maybe even 5 times higher than a learning management system. The content that will be provided could also be provided by our content experts that we have in CCSD, which are known as our teachers. as I near the end of my term on the board, I want to stand up for the teachers. I think the teachers we have in CCSD are marvelous, and they are able to work wonders, and they know our students. And I don't know that iReady knows our students in the same way. We'll likely have more than 6% of our teachers that will be at home. And I know that they're interested in being able to provide content for not just their students, but also CCSD students. And of course, that's why many of them work in this district. They specifically want to work with students in Athens-Clarke County. And so I feel like there could be a much more cost-saving venture that would also build trust with our teachers, and also reward them in a tough time for their input and their interest in this. And so I will be voting against this, but because I have such respect for our teachers, all our teachers in CCSD, I think that this is kind of a missed opportunity as a result. And also, I'm a penny pincher on things, as you could tell with the discussion about the self-evaluation for the board earlier. Thank you.
I have a.
I just want to say.
Oh, go ahead, Mr. Stevens.
Oh, I was just going to say that I am in agreement with John's sentiments here.
Thank you. Mr. Gaskins, with the iReady, students will be able to access this from home is what, like, because it's, we have sort of unrestricted access. Our students who are at home for a variety of different reasons will also be able to access this, right? Particularly those students with unfinished learning.
That is correct. They will be able to have 24-hour access.
Okay. Yeah, my sentiments are similar. I am a little bit concerned about the amount, and because we have not yet worked everything else out. But I could support it specifically, I guess, due to the current circumstances. And I do worry about those students who have unfinished learning, and those students who might be in, just at-risk situations for a variety of different reasons, that may not have, that may not come back physically to school. And so I know that these past few months there's probably been a lot of unfinished learning. And so there is some discomfort here with the amount, but I do think I'll be supporting it.
Yeah, I've been thinking the same as John, especially in terms of our faculty and teachers and using them and their expertise. But the last sentence of that Dr. Gant just stated in terms of students and unfinished learners, I think that we're like every other district, we're in a challenging place. And so I am so very much torn. I was hoping we were going to table this and have a little bit more time to think about it. I feel a little overwhelmed actually making a decision about this. That price tag is pretty hefty. I'm not comfortable with that tag, but I do want students to have every opportunity that they can. And since it is offered 24/7, I reluctantly, I will vote for it, but I do, I totally agree with everything that Dr. Knott said, but I'm gonna go with this for the students in hopes that they would truly utilize this, with this price tag, that it'll definitely be utilized. Hopefully we can get some reporting on that, later in the year.
If I can ask Mr. Gaskins, is this per year or is this a one-time purchase? How does this function?
This is per year. It will decrease over time because the initial professional development is included in it as well.
So can you tease that out a little bit?
I think the professional development, if I am remembering correctly, is about $80,000. So we would subtract that out from
You said
next year.
8 or
80.
$80,000.
Wow.
I think the other thing that as we become more comfortable with iReady, it will replace some of the existing things that we do spend time and money on. As I mentioned, it does have standards mastery, which is a assessment that helps us with progress monitoring. That would not be something that we would have to create. We have a bank of questions that we use in Illuminate to create assessments for teachers that we pay for. That would not be something that we would have to continue to pay for if we felt that iReady was more superior over time.
I think we had I think Ms. Davis mentioned this earlier. There have been a few programs similar to this, and I can't remember all of them when I was working for the district. And this might be from a total different area, but I think I heard someone mention Read 180, or there were a few different things I think that we have used previously to help with, I don't know if it was unfinished learning, but to help increase some of those academic areas.
I know I had cousins that moved here from Michigan, and they weren't on the same grade level with the kids in the middle school. And they used that program. I can't remember what it was, but I do remember one of the kids earning a notebook for completing it. And I really love the way that system worked, because when he was going down a path that he had mastered, then it just simply, he could continue, but it would elevate his opportunities. And so he was actually graduating back up. So, I mean, literally within like 2 months, he was on track and rolling. So I think it's a fantastic tool if we're talking about closing gaps for kids and having them feel comfortable in doing that. So yeah, I think it's a great opportunity for our kids.
Dr. Knox?
Yeah. Yes, I just wanted to reconfirm, as they say sometimes, the price tag on this. So the initial cost that's in here in the fine print somewhere on here is $492,637, right? 492,000, almost 500,000. And so there's about 80,000 in training. That's a 1-year thing. So that would drop it to a little over 400,000 per year for iReady.
I believe that is correct.
Okay, thank you.
If there are no other questions, or discussion points, Mr. Gaskins, if you would take roll for us.
Yes, ma'am. Mr. Davis?
Yes.
Mr. Stevens?
No.
Ms. Davis?
Yes.
Dr. Yeager?
Yes.
Dr. Dykeman?
Yes.
Mr. Worthy?
Yes.
Dr. Gant?
Yes.
Dr. Knox?
No.
Dr. Maddox?
Yes.
So that motion carries 7-2, Mr. Gaskins?
That is correct, Dr. Gant.
Okay. We are at the action to approve Norm 13B. Let's see.
That's correct.
Okay. Were there any, I know this has been sent out, it's sort of made its rounds. Are there any, Dr. Knox, you can go ahead.
Let's just go ahead. I move to adopt Norm 13B, which is how to address situations in which board officers do not follow board policy.
I second. Sorry, Trish.
Okay, so we have a motion from Dr. Knox and a second from Dr. Yeager.
Yes, give her credit.
Oh, okay. Were there any follow-up questions or discussions for the team that put forth this norm?
I do have a question, because I thought this was spelled out someplace else. And so I'm just wondering, I kind of looked at the norm itself, and I didn't have a chance to finish my research, but is this not already specified in either the law or in, I don't think it was in the Code of Ethics, but I thought that this was spelled out in terms of, and maybe it's even Robert's Rules of Order, but I've seen this information before in terms of a process for doing this.
Yes. If I may respond, you saw it in Norm 13A, which we approved. It's very similar to 13A. We split
No, I'm
off.
talking about, yeah, I meant to raise
Well,
the same
I'm sorry.
question on 13A.
I just let me finish. So
I
in
apologize.
13A, we talked about non-officers, and in 13B, we talk about officers. It makes things a little bit different. But to my knowledge, and we did some research on this in our norms committee, we could not find anything where it was spelled out. And now I will toss the baton to Mike Pruitt. Mr. Pruitt, can you confirm or deny that there's nothing like this in other policies or state code or Robert's rules?
Yeah, that's right. The only thing that's in state law or state regulation is what you already have in your policies, BH and BHA. So all of this is in addition to that.
Okay, if I find it, I'll just bring it back. Thank you so much.
And you know, with our norms, it's not policy, so we can, it's what we're doing, sort of like best practices and things like that. And so in the future, if there are things that need to be visited, I think we'll by the time we're done with these norms, I think we'll be able to revisit anything efficiently and point right to what we need to change.
The learning is good.
All right. Any other questions? Okay, I don't see any hands, but just, okay. Mr. Gaskins, can you take roll for us?
Yes, ma'am. Mr. Davis?
Yes.
Mr. Stevens?
Yes.
Miss Davis?
Yes.
Dr. Yeager?
Yes.
Dr. Dykeman?
Yes.
Mr. Worthy?
Yes.
Dr. Gant?
Yes.
Dr. Knox?
Yes.
Dr. Maddox?
Yes.
Okay, that motion carries. Now we are at adjournment.
John's got a question.
Oh, sorry, Dr.
Just
Knox.
the quickest of comments. I'm going to kind of tell people, look at the norms that have come out. Whose committee is winning the prize so far for the most norms? That's Dr. Gant's committee. It's Dr. Gant's committee.
I'm looking at Linda and I'm looking at Kara, and
We have one that we're almost ready.
Okay,
I
get on the
have one that's
stick.
ready. It'll be out by, you know what, I promised you guys a couple of days ago, but I'm so glad we had our training because I am going to send this out even though I don't have these policies in order. You just have to look for them. But yeah,
We're
it's
on
done.
it.
Okay,
And,
just
you
get
know,
on the stick.
Yeah, it is, our team has spent a good bit of time. Thank you to Dr. Knox, and Dr. Thomas has actually sat in on our meetings and participated, and Mr. Stevens, as well as Mr. Pruitt. And so they've made for some long meetings, but some really, really good meetings that we're able to
yeah, more people.
We do? Oh, well, we just invited. We figured it would save a lot of work in the long run. But I will also make a quick note to let you know that we have also asked SBA to just take a look at the ones that we've adopted so far, right? Just to be sure that we're heading in the right direction. We would hate to get like the 13 or 14 norms later. And that was, I think that may have been suggested by Mr. Pruitt and Dr. Knox. But we've had quite the productive team. So I am very appreciative for the work that they have put forward.
In middle school, there was always a group that excelled, and I was never in that group. Go ahead.
Are we adjourned?
I want to be moved.
Are we adjourned?
So moved.
Okay, is there a second?
Second.
Thank you to all the public that stayed.
Okay. I don't see any objections. We are adjourned at 12:21 a.m. on July the 10th.
We did it. The 2-day meeting.
Have a good night.